Is Groundhog Day, correct? Yeah. Oh, is that what they decided? Okay. All right, thank you. I'll look to the
In order to protect public health and the safety of our Tuolumne County citizens, this supervisors meeting will be physically closed to the public. During citizens who wish to call 209-533-6581 to queue for verbal public comment. The item. Ask if there are any comments from the public, and at that time, your call will be taken in the orders received. The public comment time. The staff. For public access audio and video live streaming. The public will not have access for public comment. These media, these are available for option. Tuolumne. Using www. Watch live, or you can go to Comcast Cable 8. Option number 3, Zoom webinar via your computer. https://zoom.us/j98737385155, or you can call in at 1-669-990-9128 with webinar ID 987-3738-515. Important public notice under the Governor's Executive Order N2520. This meeting will conference and under Order N2920. Accessibility. If you need special assistance during the board meeting, please call 9-365.
All right, thank you, Ms. Ryan. So at this time, communications, the public may speak. That's not on the printed agenda. By the back, if we have any. Hi, you're on with the board.
So the reason for my call in for the homeless camp, move it. The people on that this will. I don't think that our business will stay there. I think we'll move somewhere else or just close up altogether. Serious situation that the sheriff isn't able to handle. Call multiple times a day into them about homelessness issues already. To send a deputy down. So putting an entire homeless population down there, I can't see how that would benefit the town in any sort of across from my business. So I just want to, in 3 years, and we keep fighting. So.
Okay. Thank you very much. We really appreciate you calling and voicing your opinion. I'm going to look. Is it okay? So we have some more folks that would like to speak. And you're on with the board.
Yes, hi, good morning. I'd like to take this to thank all of you for the work that you've been doing, but mostly this morning I'd like to thank Supervisor Brendan for the town hall that he conducted. I was not able to attend, but his work on this subject, but it is a growing problem across the nation. Hopefully seeing more town halls to get more input and more ideas on how we can work together to solve this problem in our community.
All right, so we are back from our break. Apologies for the technical difficulties. We're still working on getting access on Granicus, but the meeting is available on Access Tuolumne and then through the Zoom link provided on the agenda. So people can watch the meeting there and continue to call in as usual, and we'll continue working the other problem. Oh, okay. I'm getting a thumbs up from our IT wizard there, so it looks like we might be fixed. That's awesome, and he's leaving the room, so that's even more encouraging. So I believe where we left off was we had finished oral communication, and so we were going to move on to staff reports. So staff can present public service announcements, commendations of staff, and brief project updates, and no action can be taken by the board on these items.
Hi, good morning. This is Michelle Jaquetta, Public Health Director. I just wanted to share with your board and the public this morning that February is National Children's Dental Health Month. This month-long National Health Observance brings together dedicated professionals, healthcare providers, educators, and public health to promote the benefits and importance of good oral health to children, their caregivers, teachers, and many others. So you will see a media campaign through our traditional media venues and our social media pages, sharing information and highlighting Children's Dental Health Month, as well as the public can reach out to Public Health at 533-7401 or our email health@tuolumnecounty.ca.gov for information about our local oral health program through Public Health, or for information on how to access dental care for their children. Thank you.
All right, thank you.
Good morning, Kim McFarland, Director of Public Works. And after almost 4 years without a full-time solid waste manager, I'm very happy to introduce you to our new solid waste director, Jim McCargue. Jim brings with him over 20 years of experience and a wealth of knowledge in the public sector. He's going to help us out with our organics diversion issue and treated wood waste, and we're really thrilled to have Jim on board.
Good morning, and I'm grateful for the opportunity to be here in Tuolumne County. It's an exciting new time with lots of interesting challenges ahead, but look forward to hit the ground running, and I think it's an opportune time. I know there's 3 new board members, so looking forward to a bright future.
All right, well, welcome, and I'm very interested in trash, so we'll
Kim,
definitely be speaking soon.
can we get him an office in the Pinecrest Basin?
Yeah,
That'd be great. Thank you.
I wore my boots, so I'm ready for the garbage.
I just wanted to say welcome.
Good morning, Quincy Yaley, Community Development Department Director. I wanted to let you and the public know that the Development and Permit Service counter will be reopening to the public. It's located on the 4th floor of the A&F building at 48 Yaney and will be open for walk-in customers starting on Monday, February 8th. The CDD operating hours are Monday through Thursday, 8:30 to noon and 1 to 3, and the counter is closed on Fridays. In addition to our counter operations, you can always contact us at 533-5637 or send us an email at cdd@tuolumnecounty.ca.gov. And there also is a staff directory on our website if you need to get direct contact to anyone. Please use the hand sanitizer available in the lobby prior to visiting our counter. And if we have more than 4 individuals being helped at the counter at one time, we will ask you to wait outside in the atrium inside the building. Our inspections continue on our regular schedules, Monday through Friday, as long as the contractors or when we visit a site, there's no signs of illness and we can maintain safe protocols. If you again have any environmental health emergencies, 533-5665, building emergencies at 533-5637. So we look forward to seeing our customers again in person. Thank you.
Okay, thank you. All right, any other staff reports? Okay, I don't see, I see Mo coming in, but no, okay, no more staff reports. All right, so we'll move on to consent calendar. I'll look to Board Clerk Ryan to read the consent calendar.
Item number 1, approving the minutes of the January 19, 2021, January 20, 2021, January 21, 2021, January 22, 2021, and January 29, 2021 meetings. Number 2, approving an amendment to a retainer agreement with the law firm Liebert Cassidy Whitmore for an additional $40,000, not to exceed $100,000 annually, authorizing the chair to sign. Number 3, as the Air Pollution Control Board, approving Resolution 06-21, authorizing the Air Pollution Control District to continue participation in the Carl Moyer Grant Program Year 23 FY 2021 for $200,000 to qualifying projects. Number 4, as the Air Pollution Control Board, set a public hearing date of March 2nd, 2021 at 10 a.m. to review and receive comment on the Air Pollution Control District 2020-2021 budget. Number 5, consideration of approving the notice of completion for contract number 1715-12, emergency storm damage repair construction on Little Fuller Road, and authorizing the chair to sign the notice. Number 6, approving the 2021 Local Child Care and Development Planning Council membership report, authorizing the chair to sign. Number 7, approving a memorandum of understanding with the California Department of Public Health Valencia Branch Laboratory for testing services of COVID-19 samples, and authorizing the county administrative officer to sign all documents. Number 8, thanking the Tuolumne County Planning Commissioners for Districts 1, 4, 5, and 1 at-large member for their service, and directing the board clerk to send letters of appreciation and post a notice of vacancy.
All right, thank you. So first, what I'll do is I'll look to the board to see if there's any item a board member would like to pull from the consent agenda. Okay, so Supervisor Half would like to pull item number 5, is that correct? Okay, so we'll pull that item. Okay, now I'll look to see, is there any public comment on the consent agenda? Okay, any comments from the board on consent? No comments? Okay, all right, so I'll look for a motion to approve the consent.
So moved.
Okay, motion by Supervisor Brandon. Do I have a second?
I'll second.
Okay. Second by Supervisor Goldenberg. I guess I can just call for the vote. Everybody's here. All those in favor, please say aye. Aye.
Aye.
Opposed, abstain? Okay, so consent is approved 5-0. Now I'll look to the clerk. Could you please read item number 5 one more time?
Item number 5, consideration of approving the notice of completion for contract number 1715-12, emergency storm damage repair construction on Little Fuller Road, and authorizing the chair to sign the notice.
Good morning.
Good morning. We discussed this over the weekend, and what I would like to know, and it's for the public's benefit too, there's a cost overrun of $92,859 on this project. So it doesn't say in the memo. I'd like to know where this money is coming from to pay for this overrun in cost.
This project is a FEMA project, 2017 storms. So it is reimbursed 75% FEMA, 18.75% Cal OES, and 6.25% local match. In our 2021 budget, we had $1,038,500, which is more than adequate to cover the costs. We always add a 10% contingency and a 15% construction engineering budget into our capital project.
So are you saying that those percentages you gave, certain FEMA, certain state, also apply to an overrun, a cost overrun?
Yes.
Okay, that's good to know. So what is the actual cost to the county?
For the construction contract?
For the overrun.
I calculated on the entire contract, the $881,000.
Okay.
Our match is $64,906.
Okay, great. Thank you so much.
Thank you.
Okay, any other discussion on item number 5? Okay, all right, so I'll look for a motion. Oh, yes, thank you. Apologies, so I'd like to see if there's any public comment on item number 5. No, okay. All right, no comment on that item specifically, so now I'll call for the vote. Or call for a motion.
I move that we approve number 5, consideration of approving notice of completion for the contract on Little Fuller Road.
I'll second.
All right, motion by Supervisor Half, second by Supervisor Kirk. All those in favor, please say aye.
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 Opposed? Abstain? Okay. Motion passes 5-0. All right, thanks very much. Okay, so we'll move on to our 9 o'clock appointment. I'll look to the board clerk to read that appointment for us.
9 a.m. presentation and planning status update of the novel coronavirus COVID-19.
All right, good morning.
Campbell, members of the board, Ms. Creel, Ms. Riggs, my name is Rebecca Espino, Health and Human Services Agency Director. We are excited to report that the trend of COVID-19 cases and hospitalizations can continue to decline. We are also excited to report it has been 45 short days since receiving our first batch of vaccine, and already over 10% of our community has been vaccinated. Vaccine clinics are occurring every week, and we are confident if we receive a steady flow of vaccine, this percentage could substantially increase in the upcoming 45 days. A lot of hard work from a lot of dedicated people who care deeply about our community continue to partner with our medical community towards a common goal of eradicating COVID from our lives. One such partnership is Adventist Health Sonora, and we are thankful Dr. Hurd has joined us today to share information and answer questions. So without further delay, Dr. Surjenko.
Morning, Doctor.
Good morning, Chair. Good morning, Board. Good to see in person the 3 new members of the board. I think given the Mona wind event and the snowstorm, we've had enough disasters occurring on Tuesday for a while. So pleased to be here in person and to have met the new board members. As Rebecca said, we're actually looking at a downward trend, and I'm going to drive slides and try and talk at the same time, so we'll see how that works. But again, we're seeing a decreasing number of cases, but what I always remind the board of is that both our hospitalizations and our deaths lag about 10 to 14 days behind our surge in cases. And so as you'll note, since the last time we met with the board, there have been 10 deaths, and those are resulting of the surge that occurred over the Christmas and New Year's holidays. We still have 9 cases that are hospitalized, with at least 6 of those being Tuolumne residents. I also know one of them is a Mariposa County resident. We are continuing to see that trend down, and Dr. Hurd will talk in a bit about how surge is impacting the hospital, and he'll provide more at that point in time. As you can see from our current epidemiology curve, we are seeing that decreasing trend in cases. That is encouraging. However, we're still well above thresholds to come out of the tier 1 or purple tier, and we'll talk about that in just a moment. Statewide, we're also seeing a decrease in cases and dramatically dropping off. This is a positive sign. However, as I was talking to some of the board members during our impromptu break, we do have variants out there, including a Brazilian variant that I'm very concerned about, that is occurring in populations that had been previously had a high level of prevalence, a high level of disease, and suggests that immunity may not be, may be waning. With the other two variants, the South African variant and the UK variant, less concerned because our vaccines seem to be effective with that. That said, the other picture on this slide is, again, we're seeing a decrease in cases statewide, but the number of deaths has yet to fall off. Again, that lags behind cases by at least 10 to 14 days and sometimes longer. Because of that decrease in cases, the regional stay-at-home order was lifted last Monday. And what I'll remind the board is that the lifting of the stay-at-home order is not based upon current ICU occupancy, but rather the modeled ICU occupancy 4 weeks out from the date that the data is run. So on the 24th, the state ran the ICU data and then ran it through a projection. And then what that showed is that we would be reaching about 15% bed availability by mid-month. Currently, however, we're still kind of stressed, where on any given day we have about 5 to 10% ICU bed availability. I've explained this to others as we've gone from really, really bad to just really bad. And really bad would be how I would describe one of our worst flu seasons in recent history, which was the 2017-2018 influenza season. In February of that year, our EMS crews were looking at what we call 2 to 3 hour wall times. That is, an ambulance would go to a hospital and have to wait about 3 hours to turn a patient over to the nurse in that emergency department. That is what we're seeing right now. That is in contrast to about 3 weeks ago when both Sonora Adventist and John C. Fremont, the other hospital I help with, we were flying patients out of state to Reno, Nevada to get tertiary care services simply because we could not find an available ICU bed in the state of California. And I would point out that these were for non-COVID patients. One was a cancer patient, one was a dialysis patient, and the third was a septic patient. So what this reflects is that not only are COVID patients occupying ICU beds, but we still have the ongoing diseases that occur day to day in our counties. This is the epidemiology curve for our area and for the new board members. Tuolumne is part of a 4-county, 1-park Yosemite Gateway Area Coordination Team, our YOGACT for short. The YOGACT has an epidemiology surveillance unit that collects data from not only the region but around the state, and that allows us to do some in-depth analysis associated with the pandemic, especially how it affects our region. In this slide, this is the case rate, which is a 7-day average, which does include our prison population. Tuolumne is the light blue line. And again, our biggest peak was first after the Halloween gatherings. We saw a peak there, then after Thanksgiving, and then actually less so over Christmas. And then since Christmas, since the New Year's, all of our jurisdictions in the region have seen a decrease in cases. I would be cautious about the last couple of days where you see that huge deflection downwards. That reflects data lag. But in general, in all of our counties, we're seeing a decrease in cases. And again, that reflects in ICU hospitalizations and in deaths downstream, and thus the lifting of the regional stay-at-home order. So for Tuolumne specifically, again, we went from the regional stay-at-home order being lifted to going back into the blueprint for a safer economy tiers, which puts us in the purple tier. And what we're looking at there is our case rate is 21.8 new cases per day per 100,000, and that per 100,000 bit allows us to standardize data across counties. The other piece of data that we look at on a weekly basis is our test positivity rate, and that has been 5.4%. So in moving forward, and I know that's a question that the board had posed to us prior to the presentation, is that I'm less concerned about the positivity rate. We managed to hit that metric fairly well, and we have seen a downward trend in the adjusted case rate. For us to move into the red tier, which is the less restrictive tier than the purple tier that we're currently in, we would need to have less than 7 cases per day per 100,000 as a 7-day average with a 7-day lag. And we would need that for 2 weeks. So what that means is that we grab 2 blocks, 2 weeks of data, but we look at it retrospectively from 7 days. So if we looked at it from the 30th of January, we would look at the 2 weeks from the 23rd going backwards. And if for each of those 2 weeks as a county, we had 26 or fewer cases per week, then we would move forward into the red tier. To move into the orange tier, we would need to be in the red tier for 2 weeks and then have 15 or less cases per week for 2 consecutive weeks. So that's how we move forward into those less restrictive tiers. Honestly, I don't see us moving into the yellow tier unless we're very fortuitous. We have a lot of vaccine uptake and disease transmission is cut significantly. On the other hand, as I look at the guidance between the orange tier and the yellow tier, it really the changes are very subtle in terms of restrictions on the economy. All right, I'm going to shift gears to surge, and then next slide I'll hand, not this slide, but the next slide I'll hand over to Dr. Hurd. As indicated, with a decrease in hospitalizations, we are again seeing a decrease in both ICU consumption and bed hospitalization in general. So that's a positive sign. And now, I don't know the magic that's required to hand it over to Dr. Hurd, but he's going to talk to this slide. Alex, are you there?
I am here, and thank you so much for the board. Eric and I tag team quite often on these presentations, and we're getting sort of used to it. Our surge planning, we are continuing to look twice daily at our hospital occupancy and our materials and our staff. We are in fairly good shape. The numbers, I'll just update the numbers from what Eric had showed earlier. We have 3 active COVID patients in the hospital and 3 patients who have sort of exited the active stage. We have capacity in the ICU, we have capacity on our med-surg floors, and we have the staffing to meet whatever the needs are. We have enough both medication and equipment on hand to weather the storm if we do get an increase in patients. And we are just super excited to start that vaccination and hopefully prevent some of the cases rather than just reacting to them.
All right, and oh, go ahead.
I was just going to say, those are my comments on this slide. Yep.
Great, and if you'll hang out and talk about vaccine, I think that actually really was exciting, and I was really pleased to drop in on your clinic on Saturday.
Sure.
All right. I'm going to pass it over to Michelle Giacchetta to talk about testing.
Good morning again. Okay, go ahead.
So before we move on, any questions for Dr. Hurd on the hospital? Okay, all righty.
Great. So moving on to testing, approximately 65,000 tests have been conducted. As noted in yesterday's daily update, we did make that transition to reporting the number of tests that have been conducted within the county among Tuolumne County residents rather than the number of residents, as that more accurately reflects the level of testing that's being conducted in the county. So that's why that number is larger today. There have been 47,474 community member tests and 17,524 done among SCC inmates. Testing is available through local providers, through Adventist Health Sonora, the OptumServe state testing sites at the Motherlode Fairgrounds, which is open 7 days a week, and now the travel sites that are open in Tuolumne on Thursdays, and Groveland at the community hall on Mondays, same hours, 7 a.m. to 7 p.m. Appointments are recommended, but they are accepting walk-ins at this time. The website for making appointments is still lhi.care/COVID testing, or the phone number there, 888-634-1123. Again, testing recommendations. We recommend that folks get tested 5 days after any travel or close contact with anyone outside of your family bubble. If you're experiencing any symptoms, to get tested right away. And every 14 to 28 days if you regularly work with the public. All right. Okay, vaccine plan. Do you want to do this one? Oh, okay. So I'll talk a little bit and introduce us into our vaccine section. This chart here, it shows the number of vaccines received by Tuolumne County Public Health in the top graph, the number of first doses given, the number of second doses given by public health. Oh, looks like there's an accidental. Oh, how many received and how many given? My apologies. The number received by public health there includes 1,000 doses that were redistributed to Adventist Health Sonora for them to facilitate their clinic this past weekend and going into this weekend. The second part of the chart there shows vaccines given among our healthcare partners. And this is as of 1/29, and I believe there are quite a bit more vaccines that have been given out since this chart has been updated. And again, as Rebecca mentioned, at least 10% of or approximately 10% of our population has been vaccinated in the past 45 days. And that's considering our population includes youth, and those under 18 are not getting vaccinated at this time. At the bottom of the chart shows our planned or conducted points of dispensing or pods. And as we speak, we are conducting one today. And so we hope we have 600 first doses on hand, and that is our goal to get out today.
And I'll just tag team on that, because that's a very familiar picture on the right. We continue to do, from Adventist Health standpoint, weekend clinics. We were doing another one this weekend. We did 800 last weekend, 1,000 the weekend before. We'll do another 800 this weekend. And it really depends on, the vaccine that we get. We will not hold it, and we will get it out. And so what I would recommend for the public is some patience in scheduling your appointments and navigating through the systems of where to find those schedules. There will be continued outreach. We will not forget anybody. And as we get the vaccine, we'll get it out as soon as we can.
Thank you for sharing that, and I would second that for public health. And I will turn it over to Dr. Surjenko.
Okay, so one thing that I don't have a lot of writing on, but a lot of comment on, is this first bullet, which is the third-party administrator, which you may have seen in the news, is the governor last week proposed a contract with Blue Shield, supported by Kaiser, as a third-party administrator at the state level to facilitate allocation and distribution of vaccines. The concern with this is the role that the local health jurisdictions, including your public health department, would have in directing the allocation of those vaccines. We are concerned that we may be, for want of a better term, cut out of that distribution pattern. And so we have expressed to the state, as well as through the OGAC, to our elected officials, that we do need the local health jurisdiction voice heard with the implementation of this third-party administrator to ensure that at the local level, vaccines are getting to the populations that will benefit from them most. And that realistically, a third-party administrator at the state level does not know our communities as well as we do, and does not have the partnerships with the health delivery system that we do. So I think that's something the board needs to be mindful of. I will say that other counties within the Yosemite Gateway Area Coordination Team are drafting up letters to send to the governor. Madeira had sent theirs off this weekend. Mariposa is developing theirs now, as is Mono. And I've been talking with Rebecca about drafting one up for the board's action for here, if that is your desire. Other things on this slide, again, we're looking at the two types of vaccines we're distributing right now are the Pfizer and Moderna. They are two-dose vaccines. And so we need to think about having second doses on hand. It is one of the questions we get from the public is, are we saving vaccines? And we are conserving some of them, but we do depend upon resupply from the state to ensure that we have enough on hand for the second dose. A third vaccine is likely to go under Food and Drug Administration emergency use authorization in the next week or two. Last Friday, Johnson & Johnson indicated that their vaccine study had accumulated enough cases to submit data to the Federal Food and Drug Administration. What we know from the Pfizer and Moderna approval process is it took about 2 weeks for the FDA to approve it, and then the CDC, through their Advisory Committee on Immunization Practices, took another week. So from the time that Johnson & Johnson submits their data to the FDA, we might see a third vaccine fielded. So perhaps end of February, maybe optimistic there, but certainly by the middle of March, end of March, we'll see a third vaccine. And Johnson & Johnson has indicated that they would be making over 100 million doses between now and August. The advantage of the Johnson & Johnson vaccine is it is a single dose. However, as a single dose, it is less effective than the Pfizer and Moderna vaccines after the second dose. So it'll be interesting to see how the Advisory Committee on Immunization Practices directs or suggests the use of the Johnson & Johnson vaccine in contrast to the Pfizer and Moderna vaccine. As has already been pointed out, who is vaccinating? In addition to our established healthcare facilities and public health and the partnerships we have there, there is a federal partnership program with CVS and Walgreens that reaches out into our skilled nursing facilities, and we have had them in our skilled nursing facilities providing vaccines there. As Rebecca indicated, we've had over 10% of our population vaccinated. We're working through our Phase 1A, which includes all of our healthcare workers, our in-home supportive services, our EMS, and we've begun working down into Phase 1B Tier 1. And currently we're addressing everyone depending upon the clinic, but for our public health clinic, we're looking at 80 and older. Some of the other clinics have gotten into younger folks, and that is okay. We can go as low as 65 under the guidelines, but really where I know that the impact will be is those who are 75 and older. But we're also putting vaccines into the arms of those who are in education services, working through what are called closed points of dispensing, and then also into our non-EMS emergency services like law enforcement. I'm going to push that back to you.
Is this the same thing? Okay, so upcoming vaccination clinics, again, I think this might be a little bit repetitive, but we have, like the pod today is doing our education sector and others in Phase 1B, Tier 1, including individuals who are 80 and older. Adventist upcoming clinics, vaccinating 75 and over. The links here, the top one is for our COVID vaccination page for public health, and we recommend that everybody follow that page for updates and information. And the other link below that is Adventist Health's vaccine information page. And again, I guess this is just sort of a repetitive slide, but CVS and Walgreens vaccinating our skilled nursing residents and their staff.
All right, and then again, just as a reminder, what the phases look like graphically. I will say that not a concern, but a direction change from the state is that we will complete Phase 1A, we'll complete Phase 1B, Tier 1, but then for Tier 2 and Phase 1C, this will be replaced by an age-based program where we start with our oldest and go towards our youngest. Plus, in something that we've heard but not seen in writing yet is a likelihood of including at-risk patients. But again, that is to be determined, and as soon as we have direction on that, we will let the board know.
Yep, oh, it always takes just a few seconds.
Chairman, members of the board, I'm Corey Alanunda, representing your Education and Compliance Division, specific to businesses and the COVID-19 response. Since the beginning of our involvement, we've had 232 businesses. Can you please change the slide? Who have received 623 complaints. Thank you so much. That is 5 new businesses identified in the last 2 weeks or since your last board meeting, and 28 new complaints since that time as well. I will say at about a 5-to-1 ratio, those complaints hit in the eateries or restaurants, both within the city and within the county limits. We've sent 3 oversight letters since the last time we've shared out. And since the stay-at-home order has lifted, that did modify some of the restrictions specific to restaurants who can then again open outdoors. Short-term lodging was able to reopen with modifications, and salons were able to, with modifications, reopen. Those were the key changes, along with some others, more subtle changes that occurred. Since our last report out, since January 19th, we've sent 1 restaurant a letter within the city, and 1 restaurant to a letter to a restaurant, and 1 to a salon within the county proper. So that's where your letters have come from our division since the last report out. And the last thing I want to share with you is we did talk about how we want to proceed as a division. We have 3 options that we would outline for you. The first would to shift to a minimal complaint investigation process that would be limited to letters to the businesses and letters to oversight. We would do that using existing disaster service workers and limiting their time to around 20 hours per week. The funding for that would be from your epidemiology and laboratory capacity, or ELC funding, and we would limit that to closer to $2,000 a month cost. Option 2 would be a slight enhancement to that more moderate complaint investigation, providing additional resources and additional staffing. And then option 3, which is where we're currently operating, which would be more of your in-person response to the business community. The recommendation that the agency would put forth is that we shift to option 1 moving forward. This would allow us to dedicate funds to the other critical areas of your pandemic response. Next slide, please. Thank you very much. That concludes what I have. Just a reminder, the guidance documents are still available to businesses at those locations listed in front of you.
Okay. Just a question right up front. So in the previous slide, under whose authority is it to choose those options? Is that the public health officer, or is that
I'll be looking
board?
to our CIO for that.
Yes, the authority for the entire response to this pandemic is under the direction of the public health officer.
Including what we see.
I can clarify that. The Education and Compliance Division was created by your Board of Supervisors, and so your board has the authority to determine what level and options you'd like to consider.
Okay. And are you looking direction on that right now?
I just want to make clear that with what the information you provided, if our public health officer does deem that this is something he would like to continue, that there is some authority that he has to continue at a certain level.
I think that there's maybe a little bit of a misunderstanding I can clarify. So the health officer under the Health and Safety Code has statutory authority to do certain things that address preventing and containing communicable disease outbreak. And so I guess maybe we would want to have a further discussion with the health officer to see if he felt like this fell within that broad category. I know certain things like contact tracing, that's definitely something that the health officer has authority over as opposed to the Board of Supervisors. This one might be something where we'd have further conversation.
So are we looking for direction now is the question
That's what I'm getting
for.
from our staff with public health is that, yes, they are asking that the board would provide direction. Do you want to scale it down or not?
Okay. So I see Supervisor Half had her hand up.
we go.
Okay, this may be redundant, but I don't remember. The ELC funding, where does that come from and how much money do we have in that pot?
This ELC funding grant is, I don't remember what the total is. It's $1.7 million, I believe, came to public health, and the budget has staffing and other response activities drafted into it. So there is a separate, this is just basic, this slide is basically informational for your board, and there is a separate agenda item on your agenda today to address this issue where we can get into more detail, and there should be, or, no?
No, the item's been pulled.
Oh, okay, never mind. So these options here would just have to be, whatever your board decides, we will have to figure that out within the budget that we've already drafted and make necessary adjustments. So, do you want to add more?
Supervisor Half, if I could, we had planned to pull that item 14. I discussed with Supervisor Campbell. We had planned to come back on 216 with a recommendation as to what the health officer would recommend in relation to education. So what we'd like to do is continue it at least for the next 2 weeks. And then when we get to the next board meeting, we'll have time to have worked with Dr. Sarjenko. So for what he would recommend related to education and compliance and at what level, or if at all.
Okay, so last I heard from last meeting, we were spending contingency money on this. That's not okay with me. So I want to make sure if there is a pot of money that is not our budget contingency money, that would be okay to continue this. But I thought we were going to make a decision on this today.
So I just became aware of the funding on Sunday. We're still looking at what the grant documents are and what it allows. There seems to be, from what Dr. Sarjenko sent us, a little more flexibility in the second round that they are working on. So we need some time to look at it. Your board had already provided direction to go through up to 60 days while we worked on this. So that's why I'm asking for just 2 more weeks while we work with public health to determine what level they might want to continue, if at all, for education and compliance.
So you can guarantee that this money is really not coming out of contingency?
I cannot guarantee. I've not read the documents.
Okay.
So I'm saying we are asking that the prior direction where it would have been contingencies for up to 60 days while we look at the grant guidance to determine if this is an eligible expense.
I do feel like last time we met, the board, we couldn't make a decision on it because it wasn't an action item, but there seemed to be support for not spending contingency money on education. So that's why I'm asking these questions.
You could continue the item till after lunch where we would have time to huddle and discuss it and come back with a recommendation then if you'd like.
Additionally, just to be procedurally clear, I think then we should open up item 14 because this one is just a presentation and planning status. So in order to actually make a decision, we should probably go ahead and hear that. Okay.
I would appreciate that. Thank you.
Okay, so what you're looking for is to, so we continue the 9 o'clock appointment and open item 14 for discussion?
We could just go through an order, or you could, we're not ready to go to item 14
Okay.
because I can't give that guarantee that it will be covered. I have not had a chance to talk with everyone. And as I said, we just became aware of this 1.7 million.
Just to be clear, the discussion we're having here is contained within item 14?
Correct.
On the agenda, okay. All right, so why don't we do that? We just discuss item 14 and then we can have this conversation at that time. Is that good for staff? Because
I can't discuss item 14 right now, though, because we have.
That's what I'm saying,
Yeah, okay.
is that we'll forego
Understood.
this discussion that we're having right now until we can get
Yes.
to that. Okay. All right, is that good with county council? Okay, all right, so let's do that. All right, so you can keep moving on. Well, first off, any other questions not related to that issue?
Well, I have some questions going back in the presentation that we didn't get to, if we could catch those before we move forward.
Yeah.
So, one of them, so concerning the vaccinations, there's been a lot of discussion out there, in the public. Certainly, I've been receiving a lot of inquiries about the value of do we hold all the second doses back, or do we move forward on first doses with there's an unknown factor? And I'd like to just get clarification. First of all, is the state standard still that we will hold back the second doses?
Well, so I think the better way of thinking about it is that the current guidance from both the state and federal levels is to administer the second dose. We do know that there's a decrement, especially in the older population, in immunogenicity after the first dose. And so that second dose, again, for our population that's 75 and older, definitely benefit from the second dose. The CDC has loosened their guidance a little bit, saying that we can defer the second dose, though it's not preferred, up to 42 days, which is an additional 2 weeks past the current guidance. And then even if you've missed that 42 days mark, you get the second dose as soon as you can. Again, the preferred idea would be to do the second dose at 28 days. This is an area that's in flux in terms of guidance from the state. Last week, if you'd asked me this question at the same time, I'd say the state's asking us to hold 50% of our second doses for second doses, but telling us to push out the other half as first doses. At this point in time, we are in hold, whether we're going to be doing that or not, because it doesn't appear, we're trying to figure out, I shouldn't say we are, the federal government is trying to figure out how to produce more doses with a limited supply that exists right now. So at this point, the state continues to get an apportionment from the federal government, about 600,000 doses a week. That breaks down to about 1,000 doses a week for us. But again, if we look at that as the needed number to vaccinate our population, it's going to take a while to get through our at-risk, well, even through our, through our eligible population. So it will be a scarce item for the foreseeable future, even with the rollout of the Johnson & Johnson vaccine.
Okay, good. I appreciate the explanation. There's, like I said, been getting a lot of questions on that area. The other question I had was on the, so we've got a downward trend, which is good. We're happy to see that. There's some concerns out there, with the lifting of the stay-at-home order, whether or not, that could equate to, an increase in cases. Do you have any feel for, right now what we're seeing in the shorter term, the biggest bang for our changing things, especially for businesses, if we can get to the red, tiers. So do you have any feel for, with this downward trend on, and I know it's very difficult, but, to look out, could we be maybe weeks out or a month out, or, do you have any thoughts on that?
Right. So we do have tools to us. Models are useful at times. Other times it can be deceiving. So we look at them with a grain of salt. But looking at the models, it looks like we have a continued downward trend, but that's based on our current effective reproductive number. So what I had mentioned to another supervisor prior to the board meeting was that every time we have seen a lifting of restrictions, whether that was the original stay-at-home order back in June or the dimmer switch back in July, or every time we've increased or relaxed guidance, we have seen increased population mobility, and increased population mobility leads to increased transmission. So I would anticipate that as we lift the regional stay-at-home order, we will see a bump in cases. That said, I think this shifts the responsibility from the state saying you shall do this to the individuals taking those individual actions that we know will reduce transmission. So as you're all doing now, wearing face coverings, maintaining social distancing, hand washing, those individual actions, but also the actions that take place at the business level, again, making sure that you set up your environment, that it has social distancing, that you're protecting your workers, et cetera. All those things that reduce transmission at the individual or business level become more important because of the lifting regional stay-at-home order, because we're increasing population mobility, we need to be able to implement those mitigations at the individual level.
Yeah, and that was my thought line too, is, the more we can do on maintaining our own efforts,
and then
the better we're going to be as a community and for their businesses.
Correct. And then the other thing that, again, you alluded to is vaccines are important. And so getting those into arms as rapidly as possible. I think we've got a great infrastructure, especially with the partnership with Adventist, where we're shifting vaccine supplies that we receive over to them as needed, as requested, because they have a very efficient operation that runs on the weekends. Again, we're putting 600 people getting their vaccinations today. So the more we can continue to do that, but really what we're seeing at this point is that we're limited by the supply of vaccines, as is the state, as is at the federal level. And I think that's something we need to be messaging about. And then the other, on the con side, the one concern I have, as I mentioned, were the variants that are coming out that appear to be more transmissible, but at this point still seem to be susceptible to the vaccine.
Okay. And my last question was regarding the sign-up process. I know we have done some electronic sign-up with our own public health, and the hospital has as well. Some of the comments that I've been getting in particular were there was concerns about first come, first serve, and people that don't have ready access to some of these electronic methods. How are we handling that? And, obviously people are worried and they want to, get their
Yep.
shot.
Exactly. So I'm going to hand that over to Shelley for.
Sure. So our online vaccine inquiry form provides us with information on an individual, what, their age, and if they're in whatever tier or business sector that they're in. And it is like first come, first serve within those phases and tiers. So not strictly first come, first serve, but first come, first serve within the phases that we're in, the tiers that we're working on at that time. So, and if people don't have access to the computer, we are taking phone calls and emails of folks saying, I can't, I don't have access to a computer and I don't know how to get on the list. So we walk them through that and we put them on the list for them.
Sure.
So,
and the other part of that, and I know Rebecca's about to speak to, is the people are signing up for multiple lists, right? They're on the county list, the hospital list, maybe their personal, clinic, lists, and just curious how the coordination of that is happening as well.
Yeah, and it's okay to do that, and we're coordinating with our partners who have, so as the hospital is working through their 800 appointment, they will reach out to us and let us know who got vaccinated so that we can remove them from our list, so we don't have to, spend hours digging through people who've already been vaccinated. So there is that coordination and partnership, and that's part of it.
Okay.
In addition, Supervisor Goldenberg, during this storm event that came in, our staff contacted every county resident over the age of 65 receiving public assistance benefits. And during those phone calls, many of them inquired about how do they get their vaccine. So right on the phone, we were helping staff or helping folks sign up electronically. So we were assisting. Yes.
Thank you so much for doing that. Very much.
Okay. Now, did you have more to present, or?
I think at this point it's just the closeouts.
Yep, just a little bit about communications, and Dory Beats, our county OES coordinator, has been assisting us as our PIO, and she wanted to add that she's been holding weekly press briefings. I think the first one was Thursday or Friday morning, and those will continue, which has been helpful for the public and for our media partners. And we are planning for a COVID information night, which will be a public forum planned for the evening of February 10th. And more details will be coming soon on that. It will be out in our daily update on the county's social media and our social media, and to the press for how people can participate in that and get some of their answers questioned in that forum. So. And then the next slide is basically just a list of lots of links to information. What's new there is a state vaccine dashboard, and there's a link there for folks if they would like to take a peek there. And our contact information. And again, just reminding everybody, as we just discussed, for us to get our case rates down and lower disease transmission, to remember to wear a face covering, maintain your 6 feet of physical distance, minimizing contact with people outside of your household. Continue to wash your hands and increase cleaning. Stay home if you are sick, having symptoms, and isolate and quarantine as instructed. If you do get those instructions from public health, and get tested. And that is the end of our presentation.
Okay. All right, so questions from the board? Okay. Supervisor Kirk?
Yeah, just, can we go to slide 11? Start at 11, then we'll go to 10 real quick. But on 11, on phase 1B, it says individual 65 and older, those who are at risk of exposure at work. So it gives the criteria, but then on slide 10, under vaccine, slide 19, I'm sorry. So it was slide 21. I'm sorry, there you go, because I'm looking at the page number. Slide 21, there you go. So it says 1B tier, 65 and older. And then lower down it says education and childcare. But then if we go to slide 19, just back a couple, it says 80 and older and then education. So is that just a discrepancy, or is that our decision or your decision?
That's the group work. So we're working backwards. So that's where we're at right now. So our intent is that the end state we're down to 60.
To get to 65.
Exactly.
Okay. And I've gotten quite a few calls, and I think I shared one with Michelle about, people who are 65 or older saying, I have a compromised health. I need the vaccination. Why are 32-year-old teachers getting the vaccination when I'm the one at risk? Can we speak to that publicly real quick?
Sure.
And does the board have any say over that? Can we say, Dr. Sergenko, don't give that 32-year-old teacher a vaccination. Give it to the 65-year-old.
So I would say at this point, probably you could give direction, and again, it's coming from the state rather than coming from me as to who that population gets vaccinated. Right. To do that, I don't know the consequences of that.
So it's coming from the state, is what we're
correct, and actually
saying.
Coming from the guidance that you're looking at right now is really derivative from the Advisory Committee on Immunization Practices at the federal level. Okay. The state at this point has shifted gears to, they've, for want of a better metaphor, have changed horses midstream. Right. And have gone from this sort of tiering mechanisms with these groups to an age-based only. And when we actually jump from one horse to the other is still be determined. So at some point in time, we may just go to an age-based before we've gone through all of the phase 1B tier 1 group. I'm just going to say at this point, keep doing what we're doing. Right. Because we do know that we want to get schools back into full function. Having those teachers protected is an important part of that, as is make sure our emergency services like the sheriff and police get them vaccinated so we can continue performing their critical functions.
And I just want to make sure it wasn't, so the public knew, it wasn't, the board doesn't decide these policies.
Correct.
I just want to make that clear.
Yeah, and again, what I'll say is we're working backwards because we do know there really is an inflection point in terms of morbidity and mortality. That is, people who get hospitalized, people who die. Between the 65-year-olds and the 75-year-olds, there really is a marked difference in that decade. And so that's why we're working backwards into our younger population, even though they're still septuagenarians and sextuagenarians.
Okay. And then one last thing I wanted to say is just a comment, and I'm glad I just kept my mouth shut because I was about to come undone. But on, slide 18, we're talking about a third-party administrator. Could that affect the amount of vaccinations that we get moving forward? Do you see a potential for them getting in the mix?
Yes, I do, and I think that's why I wanted to make the board aware of this, and why, again, the 3 other counties in the Yoga Act are working on voicing that concern to the governor and to his administration. I know that over the weekend, amongst the leadership that makes up the multi-agency coordination group, that we were sharing emails about and there is a copy of the Madeira letter in there. And Supervisor Campbell, if you have that available to share, I'm sure that can go to the county council and then distributed further. But again, that's what I'm looking at for Mariposa, and certainly could do something similar for Tuolumne. And as I indicated, already voiced our concerns as the area coordination team to Assemblyman Bigelow and to the senator as well.
Yeah, I just want to, I think we need to get on board immediately and support that. I don't know if it's also just locally, but also RCRC, but you're starting to feel what I've been feeling since April, which is we have no freaking local control over any of this. Or we think we do, but this is just a prime example how to me, it's basically Gavin Newsom micromanaging the hell out of this and looking at you saying, you know what, your opinion doesn't matter, your region doesn't matter. It's a big think tank. We know our constituents, we know our communities, we know our populations, and that's what I've been so frustrated about from the very beginning is I believe wholeheartedly if we took that CARES Act funding and gave you the money, I think you could do much more wonders than the state could. I mean, this whole regional thing, I get it, but when I look at Calaveras, Mariposa, us, like we're our own little region, and yet we're punishing these businesses and we're pushing them up against the walls, and now I feel like people's lives are really on the line because now we might be getting less vaccinations in the future. And I'm not a huge vaccine fan, but when I talk to people who are older and have compromised immune systems, this is a big deal. And so anything we can do to support you, Dr. Surjanko, get on that letter, get with the RCRC. I know you're an alternate. I'll jump on the phone today. I'm sure they're aware of it. I got wind of this last week, but now it's obviously really coming into play.
Yeah.
This is just unacceptable for me.
So what I was going to propose once we got there was that, we are working through the OGAC, but I would, when the time comes, I would propose that we actually start working on this within the county, doing our own advocacy through ourselves, through our partners in CSAC and RCRC, and using all those tools available to us.
Supervisor Campbell?
And the work on that has already begun.
Yeah, go ahead.
I just want to make sure, and I just sent it to each of you individually, what CSAC and RCRC already sent. So they're already on this. They've already been proactive. A lot of us have been working on this. I also sent you a copy of the letter that was provided by the CAO, Jay Varney in Madera County. So you'll have those, and then Ryan and I were both on with Dr. Surjanko over the weekend about the letter and getting that done. So we'll get that out soon. And my intent over the weekends, we just become aware of it, was to have the board chair sign it. You guys have been very vocal about this. You've been very united about local control. So I felt very comfortable with proceeding with that, and we'll get that done. I don't know that we'll get it done today, but we can get it done quickly before the end of the week, if not tomorrow morning.
I think so Jaren first, and then Supervisor Brandon, then Supervisor Huff.
Eric Michelle, thank you. Just had a couple of questions I wanted to ask. These are some of the ones that I tend to see the most on Facebook and people emailing in, and I was hoping you might just be able to clarify some of the questions. One of them is people wanting to be helpful and suggest vaccination sites that you could potentially host clinics. And I wanted to hear, are you feeling comfortable that you have enough sites to be able to do these vaccine clinics?
I'm going to defer that.
So far, yes. We have an alternate location that we're actually using today that's that we're using for inclement weather. So we had held one at Sierra Bible Church, which was really great, and we thank them again, profusely for allowing us to use their facility, and that's a great spot. We do have another location that we're using today at the fairgrounds that provides more weather protection, and we'll be continuing to do that. We also have some other options that we looked at when we first were identifying locations. If people have something to offer or have ideas, we're welcome to receive those and consider those.
I think the other challenge is, again, with both the Pfizer and the Moderna vaccine, is they require a freezer and they require a cold chain, which is not impossible to manage.
Question 2. No,
I'm
just going to be asking about vaccine storage.
Yeah, so that creates a challenge, though. Again, through the Yosemite Gateway Area Coordination Team, we're looking at places like Groveland, where we can bring in both Mariposa and Tuolumne residents. So that's a work in progress, and it will become easier once the Johnson & Johnson vaccine comes in, which only requires refrigeration and a less rigorous cold chain management.
Great. Thank you. I'm happy to hear that there's a lot of alternative sites based on weather and what's available to work multi-regionally. I also wanted to say that YOGAC seems also like a really great regional partnership, if maybe an unfortunate acronym. But I think that's a really great approach. And Dr. Shevchenko, thank you as always for that. One question I get often too is there any way that we can acquire more vaccine? Can we buy it? Can we petition for more? Or are we very limited on what we receive?
So I think that's a question that everyone's asking from the federal level on down to us, to the individual. And, you know, there's things that can be done at the federal level. The Defense Production Act is an example. But really, even at the state level and at the local level, you know, we're getting a per capita basis of what the state's getting right now. And actually, it's at this point, it's a fair apportionment based on per capita. So I think that's, you know, holding that steady, I think is good for us. As supplies increase, getting more based upon that per capita distribution, I think would be our intent.
Great, thank you. And my last statement is I just wanted to echo Supervisor Kirk. You know, locals know this area best, and I have a lot of faith in you and the hospital and being able to distribute this. We shouldn't be having a third party do it. And I'm really happy to hear that staff and RCRC and CSAC are already taking on that letter. We do need more local control in this. They do need to, I think, trust folks that know the community the best to be able to handle this. And I think that's how we're going to lead, not only to have, you know, it's basically the best outcomes for our community. Thank you.
Supervisor Half.
Yeah, just a couple of things. On behalf of District 4 residents, especially those in Groveland, I want to thank you for setting up that site for Mondays in Groveland. Really appreciate that. And then just for the public benefit, those who may be listening, I just wanted to make sure that the number 533-7440 is the number that people who aren't capable of getting online and signing up, that would be the number they call. Is that correct?
Yes, that's correct.
All right. Thank you so much. I'm going to be posting about that.
Okay, yeah, and the concern about the third-party administrator, you know, I'll make sure to keep the board updated on that. As soon as I read about it, I was obviously very concerned, and just the implication to me is it implies that the problem with getting vaccine out to the community is at the local level, which it is not. As soon as we get vaccine, it goes into people's arms quite efficiently, and I think we've proved that. And not just our county, it's been done well at the local level in other counties. And so I really do not agree with the approach that's being discussed, and I plan to fight it as hard as we can and use every tool available to us, because, you know, this needs to be done in a fair way, and it needs to get to the local level as quickly as possible. Yeah, that's all I have to say about that. I couldn't disagree more with the plan that's being proposed. So, and you took the words out of my mouth. I was going to mention the Groveland site and the Tuolumne sites and the work that went into setting those up. So thanks very much for that. And I can't remember if I asked for public comment, but I will do so now. Do we have any public comment? Any other comments from staff?
So I'll say if people can only get out on Sundays, you can go across the border, and Coulterville has a testing site that's akin to the Groveland site that runs from 7A to 7P. Same process. It's the same traveling team. It's just their Sunday stop is Coulterville.
All righty. All right, thanks very much. Okay, are we fine moving on to our 10 a.m. appointment? You need a break? Okay. Okay. We'll go ahead and move on to our 10 a.m. appointment. I'll look to the clerk. Could you please read that item?
10 a.m. Community Development Block Grant Public Hearing on CDBG COVID-2 application selection.
Hi, good morning.
There it goes. I'm here before you as a public hearing, so I need to read this statement to begin with. Anyone has written comments regarding the county's CDBG program can be addressed to the County Administrator's Office at 2 South Green Street, Sonora. In addition to any comments that they might provide here at this hearing. On March 27th, 2020, Congress passed the CARES Act in response to COVID-19 pandemic. In response to that, the State Department of Housing and Community Development published a notice of funding availability for community development block grants, Corona's Aid Relief and Economic Security. It's more affectionately referred to as CDBG CV1 funds. And the Community Development Block Grant is run by Housing and Community Services. And that department is basically the state's arm of HUD, just to give you an idea of where they fall and what they do. The funding has been divided into 3 segments. So there's CV1, which we've already applied for, CV2, and CV3. As I just mentioned, we applied for CV1 and our allocation for that grant was $203,229. The application included money for a housing stabilization program, which, as you know, is run by ADCA here in the county. Currently, staff at HCD is reviewing our application, and we should hear any day in regards to its viability. We have no problems. It's just taking a little bit of time. They're kind of overwhelmed right now with all the grant processes. So with that, the state funding has now been available for CV2 and CV3. For CV2, it's a little over statewide, $54 million, and for CV3, it's a little over $16 million. The grant application for CV2 and CV3, which they're putting together, this is HCD in their typical style. It depends on the activity that you're applying for. So the first deadline coming up is this February 12th deadline, and some of the other programs are March 12th deadline. So that's why we're here in front of you, because what we are kind of recommending to apply for, we need to submit by February 12th. So the eligible activities for CDBG funds must meet one of the following criteria. So it needs to benefit low-income households or persons, and it must, or it must meet urgent community or development needs. In addition to that, activities must be used directly to prevent or prepare for or respond to COVID-19, and it must meet all the CDBG requirements. There are a lot of them. So it's really difficult. It's nice to have these funds available to us, but it makes it hard on the local level to try to find the programs that we already are doing or we need to do and fit these funds into them. The requirements of these grants also include CV funds must be expended within the 2-year period of execution of the contract, and all activities must have direct ties to mitigating the effects of the pandemic. And then any jurisdiction or nonprofit or organization that we work with on behalf of this application must have experience in doing this activity, and they must be ready to begin providing the services right away. The other conditions of the CDBG grant is it's really hard because you can't combine to other funding sources that would cause a duplication of benefits. So once we were notified January 7th, 2021 of the grants being available to our county, Terry Cox, who is your CDBG consultant, and I went around and started talking to various county departments to see what we can do and see how we can augment efforts that they're doing in regards to COVID. We started with innovation and business assistance. We talked to County Public Health, and we also talked to our homeless coordinator. The CDBG regulations, requirements, and the short turnaround time didn't make it possible for staff to put together an application in time to be submitted before the deadline. And it was just extremely, again, frustrating to us. For example, one of the things that we talked to Cole about is implementing a small business loan for eligible CV activities. Now, it's not the same program that Jason was running in regards to just providing assistance to businesses. This would be a full-fledged business loan committee in which loans would be made and be expected to be paid back. We have not, again, what gets us on this program is we don't have enough time to implement it at this point in time. We haven't had an active business revolving loan committee in the last 4 years, so we would have to update the procedures and guidelines. We'd have to get committee members established and do all that, and then implement the grant and get the loans out there within the 2-year period, and we wouldn't have time to do it. If we were to do some type of construction activity, we would basically have to have a shovel-ready program with plans and specs and environmental all done and be ready to start building now to be able to be done in time. So staff did look at several different options in regards to this grant. One of the things that we also talked to several other nonprofit providers that we were considering under the CV1 application. So programs like the food bank or Senior Meals on Wheels. Those were all activities that at this point in time, they weren't able to increase their beneficiaries. If we were just going to augment what they're already doing and serve the same amount of people, they could do that. But if we were looking at augmenting or increasing the beneficiaries, they couldn't take that on right now. So we landed with looking and working with ATCA again in regards to housing stabilization. We know that the governor just signed just the other day a continuation of the evictions until I believe June of this year. But we know that once that eviction moratorium is lifted, there'll be a lot of people in the county that will need rental assistance and mortgage payment assistance to ensure that they aren't evicted from their residences and they don't become homeless. So we would like to recommend to your board using CV2 and CV3 funds already to the CV1 Housing Stabilization Program for this grant. ACCA has assured us that they have the capacity to implement this program. They've been taking calls on a regular basis in regards to people that are asking and inquiring and worried about being evicted and making these payments once the eviction has been deleted. A draft application resolution is included in your board package as a reference only. That's just a reference. Staff will come back to your next meeting to seek approval for a final resolution for this grant application. One of the things, and the reason there's a resolution here, this grant requires 2 public hearings. As you know, we won't make it, the application will be due February 12th, and we have gotten a lot of jurisdictions can't make that 2-week period. And so we've been granted permission to submit our resolution after we submit our grant application. So staff is before you today to get direction to prepare a CDBG CV2-3 grant application for additional housing stabilization program activities for submission in the Housing and Community Development by February 12th, 2021. And I'm here to answer any questions you may have.
Okay, thanks a lot. Yeah, those CDBG grants are a whole other animal in terms of complexity, huh?
They are. You know, there's a lot of good that they try to do, but the rules and regulations that they develop are for statewide, and a lot of times they really are hard on rural communities to be able to do the type of programs that we want to do. It really squelches any type of flexibility or creativity that maybe we want to do.
All right, well, looking to see if there's questions. Any questions? No? Oh, okay.
So, if this goes through and we have, monies for people for moratoriums or not for moratoriums, but for mortgage assistance and rental assistance, are those going to be loans that they're going to have to pay back, or is this strictly assistance?
It's direct assistance to those people.
Okay, and does any of this money have to do with anything related to homelessness?
Well, it's preventing people from becoming homeless.
But not people homeless. It would be specifically for rental and mortgage
Yes.
payment assistance
Uh-huh.
only. Okay.
CV23 does not pay for the one of the requirements that HCD put on CV23 is they will not pay for vouchers to hotels for people who are homeless or about to be homeless and need to be quarantined because of COVID.
Okay. And then we don't need to go into great detail. I just want to clarify. I know last year or a year and a half ago, sometime in there, we had an agreement with ADCA for some funding and whatnot, and some things didn't work out the way we planned. Is that could that happen with this as well, or is this a different process?
No, it's a different process.
Okay.
This process is strictly run absolutely 100% through the county. It doesn't go through I believe it's the COC, Continuum of Care.
It's run through the county?
The CDBG is, Community Development Block Grant is a county-operated program. Between myself and Terry Cox, your CDBG consultant, we administer the programs on behalf of the county and on behalf of the 5 of you.
Okay, then I guess my question is, then what's that sentence about Amador? ADCA has the capacity to implement the program.
So ACA is currently, right now as we stand, the one provider of housing assistance in the county. They happen to be a nonprofit organization that do that. In the future, if we wanted to look at some other means of doing this type of services, we absolutely can, but right now they're the only ones that provide this service. So the money would come, the application would be sent in by Tuolumne County on behalf of ACA, and so the county would administer would provide direct supervision of making sure that ACA met their milestones, and we're providing the beneficiaries. We would turn in the every 6 months there's reports and stuff that we need to do.
Okay, thank you for clarifying that.
Oh, no problem.
All right. Any public comment? Okay, no public comment. Any other comments from the board? Okay, I'll look for a motion on, you're looking for a motion, or is this informational?
No, I'm looking for direction. So I'm looking for a motion from the board to direct staff to prepare a CDBG, CV2, CV3 grant application.
Okay.
Thanks, Mo. So moved.
I have a motion by Supervisor Brandon. Do I have a second?
I'll second.
Second by Supervisor Kirk. All those in favor, please say aye.
Aye.
Aye. Opposed? Okay.
Thank you.
Thank you. So that's a 5-0 vote. Okay, let's go ahead and move on to our back to the agenda. So I think we were on item number 9. Is that correct? Okay.
Consideration of adopting the County of Tuolumne General Permit Conditions and Specifications for Trench Cuts and Street Resurfacing Policy with an effective date of July 1, 2021.
Good morning.
Good morning. I'm Blossom Scott Heim, your supervising engineer. With me today is David Ruby, engineer 2 from our Public Works Department. The proposed policy in front of you is directed at all contractors and utility companies who perform excavation work within the public right-of-way. Focusing specifically on trench restoration, resurfacing, and maintenance. More, closer. This policy also recognizes that a one-size-fits-all approach may not be appropriate. Some roads in good or great shape would be significantly affected by construction efforts. For roads in poor shape, a properly restored trench may be in better condition than adjacent portions of the road. This policy includes key street resurfacing policies based on the Pavement Condition Index. The Engineering Division sent the draft policy to our utility company partners for review and comment on October 27th of 2020. one united comment letter from the stakeholding water and sewer agencies was received on December 2nd. At the request of your board, staff contacted the utilities again on January 20th for their input on the county's responses to the comments. We met with Tuolumne Utilities District, Tuolumne City Sanitary District, and Jamestown Sanitary District on 1/21 via Zoom, and further discussed the draft policy and their requests for additional revisions. At the time that the agenda was loaded into peak, no other comments had been received. We did receive a comment letter from Groveland Community Services District late on January 27th and made ourselves available to meet with them. However, that didn't happen. The final draft policy was sent to all utility partners again, the red line version, on January 29th. This policy was presented to the Board of Supervisors Transportation Committee at their November 16th meeting, and the committee recommended adoption. The Engineering Division has made additional revisions to the draft policy based on the second round of feedback from the utilities. The most notable changes are the allowance of slurry cement as backfill material without special approval, the allowance of grinding in the final paving operation, and the inclusion of language allowing the Public Works Director or designee to enforce the policy. It is recommended that your board adopt the County of Tuolumne general permit conditions and specifications for trench cuts and resurfacing with an effective date of July 1st, 2021.
All right, thank you very much. Comments? Okay, Supervisor Haff.
I just want to thank you and the staff that went the extra mile to make sure stakeholders had one last look at this. I know it was not required, but I think it's the courteous thing to do when we're implementing a whole new policy that everybody's going to have to abide by, and I applaud you for doing so, and I don't have any other comments. I just wanted to thank you publicly.
Thank you.
Thank you. Other comments? Okay.
I concur with that entirely. It's important to reach out and make sure that everybody has an opportunity. And, you know, the first time we go around, there was some questions on whether or not that was there. So it definitely is now, and thank you.
Thank you.
Now, I had a big file of questions that I was going to pull out somewhere. I'm just kidding. Kim Blossom, David, thank you. I appreciate it. I know I asked a lot of questions last time, and just in between, been able to email a little bit and talk about it. I really appreciate you reaching back out to the utility districts and getting an opinion and working out a solution with them. I really, as Supervisor Haff mentioned, you know, including all stakeholders and going that extra mile. I really appreciate that a lot, and I think the folks at Jamestown really appreciate that, talking with the sanitary district. I also really appreciate the attention to detail in this. Being not a road expert, not an engineer, I think, well, this is a great step. Every time we're doing some work, we should slap a pipe down and put some fiber optics in it and bring rural broadband to our area. And as you mentioned, we have a lot of variety in the roads. And so I think the detail in this policy is very clear. I think it's going to be really great to bringing accessible internet to our county. And I just wanted to commend you and your staff for all the hard work. So thank you very much. I think it's great.
Thank you.
Any comments? Okay, any public comment? Okay, we do have some public comment.
Hello. My name is Gadiel DiMattei. I'm an associate engineer here at Tuolumne Utilities District, and I've been asked to make these comments on behalf of the district. First of all, I'd like to thank the county for allowing an extra 2 weeks of discussion between us and your staff, and for making changes based on our concern. We really do appreciate that. Now, we fully recognize that this is a good policy and that all of the requirements are found in other places. However, this policy has pros and cons, both for the county and for TUD. And today I'd like to make sure that the cons are at least noted by your board. First of all, the new policy does not allow the use of slurry as a temporary driving surface. For the past 7 years, the county has allowed TUD to use slurry as a temporary driving surface. There are some disadvantages to this method, but they can be mitigated by adding extra cement to the slurry mix and by requiring the permanent fix to be placed within 45 days. Using this method has benefits such as less impact to the traveling public, eliminates the need for steel plates, and it also is safer because traffic control is used for less time and there can be a cost savings associated with it. So we'd like to request that the county continue to allow this method, if not on all roads, then at least on the low traffic roads, such as the local roads. Second, the new policy does not allow permanent pavement to be placed directly on top of slurry, but it requires a layer of aggregate base between the backfill and the permanent pavement. TUD's standard MO is to place the permanent pavement directly on top of the slurry. This has been used on miles of trench in the county roads for the past 7 years with an extremely high success rate, if not a 100% success rate. There are some disadvantages, again, to this. However, this requirement will add several steps in the construction process and will increase the time it takes to make the permanent patch. Again, we'd like you to consider to continue to allow this construction method, if not on all roads, then at least on the local roads. Third, we need to point out that the county needs more inspectors. Encroachment permits can be very expensive, and part of the money that's collected is supposed to go towards the cost of sending out an inspector. The county used to have 3 inspectors and the ability to perform compaction testing. Our fear is that currently the county only has 1 inspector and cannot perform compaction testing. Our fear is that we'll have to stop work on open trenches in order to allow the county to inspect. We would like to ask the county to consider providing more inspection as well as compaction testing so that the county can ensure quality control without sacrificing efficiency. Finally, I'd like to thank Blossom and Dave for their professionality and their willingness to partner with us on these issues that have a very large effect on TUD. Thank you very much.
All right, thank you very much. Any other public comment? Okay, I don't see any. Any comments from the board?
I have a comment or suggestion or thought. I'm probably going to get in trouble for this. If we have good relationships with people like TUD, why not video the project instead of having to wait for somebody to come out and inspect? If there's somebody on site who we have a good reputation with, can video it. Here's our trench, here's the depth, here's the rebar, blah, blah, blah. Get the okay from the county, move forward. Just a thought, I'm putting it out there, because I know I've been on, when I was building my home, had to stop for 2-3 days, wait for an inspector, when, it does hold projects up. So just something if we could think about to make things easier.
How you film it and what angle you're looking at.
I know we have relationships with, like TUD's a professional organization. I think we could benefit from some
It's something
ideas.
We've considered, especially with COVID restrictions.
There you go, COVID. It's the only time I like using the word COVID in a conversation. Thank you.
Any other comments? Or, yeah, and thanks very much, really, for all of your hard work on this. And anytime we talk about we need more broadband in this community, we need better roads, we need better infrastructure. That kind of thing doesn't happen easily, and it doesn't happen without us considering the fact that we're going to have to change how we do things. And that's what this is. It is, to me, a first step, really, in changing how we do these operations to make sure that we do have better roads, and that when we're looking at installing infrastructure for broadband, that there is a plan for doing that and allowing us to increase broadband accessibility. So, it's a learning process, but just because we did things a certain way for a long time doesn't necessarily mean that it's still the best way to do it. And I really appreciate the work that you've done working with our local partners and kind of finding that middle road where we are adjusting our policies to allow for more road improvements and more broadband internet, but also not unduly burdening the groups that actually we need to work with in order to get things done. And I think you found that middle road, and I support this. I think it's a great plan and a great idea, and just thanks a lot for your hard work.
Thank you. Thank you.
So, I was
just going to say, instead of videos, you could do FaceTime. It's all live.
Yeah. We did public comment. I'll look for a motion on the staff recommendation. So what do you need? Do you need each of the three elements? If you want to tell us what you're looking for a motion for, then we can take it from there.
Sure. It's recommended that your board adopt the County of Tuolumne General Permit Conditions and Specifications for trench cuts and street resurfacing with an effective date of July 1st, 2021.
Okay, I'll go ahead and take the privilege and make that motion. So motion by Supervisor Campbell.
I'll second it.
A second by Supervisor Goldenberg. I'll call for the vote. All those in favor, please say aye.
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 Aye. Opposed? Abstain? Okay. All right, motion passes 5-0. Thank you. Okay. You want to take a break? Okay, let's just take a 5-minute break. We'll take a 6-minute break. Okay, so we're back from our break. We left off, we were on item number 10. I'll look to the clerk. Could you please read item number 10 on our agenda today?
Presentation on the Law and Justice Center campus, background information.
Good morning. Maureen Frank, Deputy County Administrator, before you again. Back in 2009, Tuolumne County purchased 48 acres for the purpose of creating a law and justice center. And over the years since that time, we've started doing those activities. So, the Mother Lode Regional Juvenile Center, the transit hub, and then also the jail project. And then right now, currently, the state is working on the new courthouse on the site. So at this point in time, we've kind of finished phase one of the project, and it was time to really come back to your board. The previous board had asked staff to go and look at some things and give some more. They kept asking questions about, well, how much, or what is it going to look like, or where are the buildings going to be, and at that time staff didn't have any answers for them, and so we were really looking at going out and getting someone to help us answer those questions. So what we did, what we've done is now that we've finished phase one, we wanted to come back and talk to your board about stepping back and just figuring out what we wanted the rest of the campus to look like, and look at how we wanted to proceed and when might be the right time to move forward on this project. And so what county staff has done for you is we want to provide two different presentations to you. And today before you is a presentation just on background material, like how did we get here and why do we have this thing called the Law and Justice Center campus. On your following meeting on March 2nd, county staff, along with Lionactus Architects, will be here to present a second presentation to you with more details. So again, today, just as a reminder, this is presentation only, and we're not asking for any type of decisions at this point in time. And so with that, I'll get going with the presentation. At any point in time, ask me questions. I'm not going to go through the whole thing and then ask for questions at the end. So if there's something you need me to slow down or ask me about, please just let me know and I can do that. So again, today, we're just going to look at background material in regards to how did we get here as far as our Law and Justice Center campus. As always, county staff, we worked very hard on this as we talked about in our retreat. And so we like to, in our presentations, to remind the community that our mission statement is that we are committed to providing exceptional public service that creates a healthy and safe community. We exercise natural, cultural, and financial resource stewardship. We promote economic prosperity and the enhancements of quality of life. So back in 2004, the county conducted a master space needs study. At that time, we were really bursting at the seams. Every single department had staff that were, sharing offices. There was not enough room for file storage. There was boxes in hallways. It just wasn't conducive to providing a good professional atmosphere for our employees, and it was certainly we weren't able to provide the gold standard service that we wanted to provide for our citizens. So at that time, we hired a consultant, and Craig Pedro and Ann Fremd worked on the master space needs study, and they went with a consultant and talked to the departments about their current and future needs. And they looked at staffing that they had currently, right at the point in time, and they looked at staffing well into the future. And they developed, they started looking at how do we best resolve some of those issues as far as space and needs and adjacencies and things like that. Every department was interviewed, every facility was toured by the consultants and county staff. From that, then information was put into projections that then made up the master space needs study. There was not, what the space needs study showed that that was not only were most of the county departments out of space, but there was also no ability to add on or expand existing buildings at their current locations. The conclusion was either we would have to rent more facilities or we needed to buy some facilities. In this chart, the third column was not included, of course, as you note the staffing at 2021 in the original space needs study. The space needs study that was done in 2005, our current FTEs, full-time equivalents, was 171 employees. And at that time, moving over to the fourth column, the existing square footage, and GCS stands for gross square footage, we had 42,497. Looking at this, the recommendation from the consultants was really to be efficient. Looking at just 2005 and the employees we had at 2005, we need 55,957 gross square footage. And what I wanted to do is just so you noted, I wanted to just be fair and transparent. At the point in time, we have a staffing level of 151 employees, just so you know where we are as far as staffing back in 2005 and 2021. Just because we have fewer employees, it does not mean that our square footage needs are have been met or have been mitigated by fewer employees. It is so far from that. And what you will see in the next presentation on March 2nd will show you where we are in regards to this. But I just wanted to give you a snapshot in time when we did the master space needs study in 2005. This is where we were.
Mo?
Yeah.
Just wanted to see, do we have any kind of rule of thumb ideas on how those might have changed from 2005 to the present, since many of the staff levels seem to be similar, but I know that there probably were other changes?
We do, and that will be presented to you on
Okay,
March.
I just hadn't seen
No,
it.
it is a good question. It's like I wasn't sure whether to. I figured the question would be asked, so I put it in here as far as what the staffing is currently. Mm-hmm. So we'll get to that because it blows you out of the water because just a tidbit, the gross square footage recommendations that came out are far exceeds the 55,000. So you're right on. Even though our employees haven't increased, the types of services we provide, the access to the community, safety things all take into consideration without trying to get into too much. So back in 2005, the deficiency, basically, as you saw on that chart on the previous page, was 13,460 gross square foot. And that really hasn't changed, just as we were talking about. There is still a significant need to provide adequate space for our staff to do the jobs that they need to do. And it's more, as the second bullet talks about, it's more about having the right type of space to conduct department business in a safe and appropriate manner while still providing excellent customer service. I know that a lot of our citizens get extremely frustrated at times when they go to a department to try to access our services, and it's not, whether it's intuitive, it's not easy, sometimes it's not safe, and parking is a challenge, as you know. So as I just mentioned, the gross square footage only tells part of that story. And as I said, there are other types of conditions that our departments and facilities are delinquent in. Just for kicks and giggles, I don't know if people know, but most of the departments that are in some of our facilities, especially our justice partners, are in facilities that weren't built for their type of activity. So the district attorney's office is across from the high school, really not your best location, especially when school's, starting in the morning or it's ending in the afternoon. But it was originally a church that we had to remodel to try to fit them in. The probation department here on Washington Street was a U.S. Forest Service building, and then it was a library before it became probation. And then our public defender's office here also on Washington Street on the other end is basically really retail space. And if you ever been to the facility, it's not laid out in an efficient or effective way to service people. So the justice service facilities, they really lack the following things: a separate interest for staff and for the public, security measures both inside and outside the building, sufficient conference meeting rooms. A lot of times a lot of those departments, they'll hold meetings just out in like what they call the bullpen or out in a hallway because there's just no room to put people. Or you'll see a lot of departments will make reservations in this room or other conference type rooms that we have throughout the county. Storage space for records, files, evidence. Oh man, it's deficient, I guess is the best way to put it. There, even though we have a wonderful archives department, we still have a lot of requirements in regards to, especially with our justice departments, to keep certain records on site for longer periods of time that maybe some of our other departments don't have. Adequate break rooms for staff, and then again, parking for customers and our staff is really a challenge. It's a little bit hard to see this site, but to see this slide, but this just gives you a pictorial of, again, where for just the Justice Center partners, they are spread throughout out downtown Sonora, and it's not really conducive. So up at the top of the map that you see there is a district attorney's office, and as we said, it's across from the high school. Moving down then Washington Street, you have the public defender's office. And then you have the sheriff's office, which is just over here down the road a bit. And that's only part of the sheriff's office. Then you have another part of the sheriff's office is over in the Kabasu Basin, and another portion that's out at the airport. So you can just imagine the sheriff and his administrative staff in trying to manage employees in various locations is not the best situation. And then you have the grand jury, who is currently right now over at the old hospital. So for our justice partners, and then you have the new jail and the juvenile facility at the Law and Justice Center itself. So right now, our justice partners are spread throughout the city area. So again, just to be clear, and I think we talked a little bit about this in the retreat, and you heard from the department heads and the elected officials that are part of the justice partner group. They are a system. It's a criminal justice system. and they work together, because when you impact one of them, you impact all of them. And so they need to be able to work together. And the Space Needs Study of 2005 really addressed that and talked a lot about that. And they saw the benefits of really grouping the justice partners together and other departments in a way. So both of those groups could be better interdepartment collaboration. Maybe there's some times, especially when we're having to cut down on staff because of fiscal constraints, in pooling staff or sharing staff with one another, or again, to our customers, being able to provide one-stop shopping for them and able to get the services and programs and information that they need. And right now, as it stands with that map I just showed you, that's very hard. If someone goes to the DA's office over by the high school and then is referred over to the probation department, it's difficult for some of our customers. And so that's something that we're keenly aware of. So in the Master Space Needs Study, it called out to either find or build additional space for all county departments. And they really saw it as a means to increase our effectiveness and our efficiency in the way we do business. And out of the recommendations, there were two core recommendations that they made as far as all of the operations that the county has. So the first one was to create a county core administrative and financial departments and locate those departments downtown. So really look at the space that we have around here and start moving towards moving all administrative functions down to the core area in Sonora. The second recommendation that they made is then in regards to what we're talking about today is the justice partners, and providing a space for those justice partners to move out of the downtown area and create a whole new campus for them.
And I'm sorry, we're talking about the Space Needs Study from
2005.
2005, okay.
So that's what their recommendation was. So since that time, and the board in 2005, after hearing the presentation on the Space Needs Study, directed staff to work towards those recommendations. And we've been trying to slowly do that, being fiscally responsible. When opportunities came available, we started looking at ways and opportunities to be able to do that. We also wanted to, and you hear this often from us in the county administrator's office, we're also trying to get out of our leased buildings. You know, why should we pay someone else all this rent when we can own the buildings ourselves, and to be able to capture that money instead of paying rent, we're using it for services, or we're using it for maintenance of the buildings. The board also, at that time, directed us to start on the initiation of creating the Law and Justice Center campus. So that's kind of how that concept came about. Okay. So in 2005, again, we started commencing a search for property for the future development of this campus. And it was an extensive process that we went through, and worked with all the justice partners on items that were important to them, whether it be response time to certain segments of the county, and what kinds of things would a campus impacts would a campus have on wherever it was next to. So the criteria that we developed was site location. It was very important to us to have just one site, not multiple sites, because then we would be recreating what we already have downtown, just shifting it somewhere else. We also, very important to us, was access to Highway 108 and a major road. We didn't want this off-site somewhere. Infrastructure availability, wow. It's amazing, but so many sites in the county, or what's called a buildable lot, are very hard to come by. You know, we were looking for sites that we knew we didn't have to do a whole lot of work to bring infrastructure to that site. Again, traffic congestion. We didn't want to place a campus in which now we were moving a lot of employees and services and programs to one location, and just, again, either relocate a problem or making sure that we could adequately have enough property to, especially, again, provide parking for both our staff and for the customers that we're serving. Adjacent land use compatibility, making sure that wherever we were looking for property that it was compatible, that we didn't run into a NIMBY problem, that we wanted to put it in a place that was suitable for the types of programs and services that we wanted to provide. Communication systems. It's vital that, especially for the sheriff's office, to be able to, with the radios and stuff, to be able to hit the peaks for dispatch and for the deputies with their radios, and be able to do that and get out and be able to have a good communications wherever the property was. Site development cost. You know, what was it going to take? There's my favorite line is, you know, Tuolumne County flat. We have a lot of properties in our county that are buildable, might have infrastructure to them, but, you know, you have maybe 100 feet that's flat, and then it goes straight into a ravine, and so a lot of work would need to be done to make it a real usable lot for the purposes that we were looking at. And so site development costs were very important to us to make sure that we were using the community's money wisely, and we were looking for sites that could be easily developed and that wouldn't be extreme cost, just to bring the site up to something that we could then build on. And the ability for expansion. You know, we want to make sure when we build our buildings that we have enough room to think forward enough in the future that if there was ever a need to expand any of our buildings, that we have room for them. So, of course, just looking at the juvenile facility, there is a place where if we needed to add on 50, 100 years from now, you know, another housing unit, we have that space. For the jail facility, we made sure that in the design of the facility, and we actually have a door and a corridor ready for it, that if we ever needed to do another housing unit, we have space for it. So we tried to really take those things into consideration when we started looking at property. So that was the criteria. We sent out a solicitation for properties, and we're working with our community resource department, looking at what was available and what was buildable, what were the zonings, what we can do. And we ended up with originally 18 parcels. And from those 18 parcels, we did a preliminary review based on the criteria I just went over on each of those sites. And then we narrowed it down to 7 sites that best fit that criteria that we just went over. And more investigation was done from that. And from that investigation, we narrowed it down to the top 2 sites and did more investigation on top of that. And from that, then the county selected to purchase 48 acres, as we know today, adjacent from Old Wards Ferry Road and across from the from Highway 108 near the Crossroads Shopping Center. And that now has become our Law and Justice Center project. When we made the preliminary offer to the Gardella family, it was contingent upon passing the environmental studies that needed to be done on that site. It was nice. It was a beautiful site, as you guys have been out there. Beautiful views. It had been developed. Infrastructure wasn't on site, but it was close by. But it fit all the other criteria better than any of the other sites that we were looking at. And so a full environmental impact report was done along with cultural resource study. The slide that I have up now just shows you the 7 sites starting on your right side with all the way up at Stanford Park, and then you have Heritage West and Gardella, Lime Kiln, the Witt property, Sonora Ridge, and then all the way down towards Jamestown is the Black Ranch. And those are all of the, when we got down to the 7 sites, these were the 7 sites that were considered. And as you see the blue bubble, amoeba, that was really, we wanted to stay true to our criteria and what we were looking at as far as all of the things I talked about, infrastructure, easy access to majority of the major roads to be able to get in, to respond to calls. We wanted somewhere where our citizens could get to us and it wasn't very far out of the main area of the county. So from that point in 2009, as I said, we finished the environmental document and we completed the purchase of the property. That same year, we applied for grants. It just so happened that the state of California was going through some major criminal justice reform. And with that, we had SB 81, which is the juvenile facility grant that we were fortunate enough. We applied in 2009, just to tell you how long some of these things take to get done. We applied for the grant in 2009 for SB 81, and we also at that time applied for AB 900, which was the funding for the, hopefully was the funding for the jail project. It came to be that we did receive SB 81 funds, and at the time we did not receive, we received partial funding for AB 900, but not enough to do a project, so we later turned back the money. In 2010, we applied for a Corps of Engineers and Fish and Wildlife permit on the campus. That permit is good for the first phase of building on it. So the juvenile facility, the transit, and jail, and the courthouse. So later on March 3rd, I'll talk to you about if we want to proceed or do anything anytime in the future, we will have to go back and apply for a new Corps permit for that project, and I can explain why. In 2011, we installed off-site and on-site infrastructure. So the water tank up on Greenlee Road, and we were working with TUD to provide, because of the water capacity that we needed, a loop system in order to get the pressure we needed to handle the requirements of a fully built-out Law Justice Center campus. And we also needed to bring power up Old Wards Ferry Road, and we had to start in and do part of the what's now referred to as the the Justice Center Drive. So we did a portion of that at that point in time in 2011. And that was one of the conditions, that we had to have that infrastructure into the project site before the state of California, who was interested in also being on this site, before they would buy the what turns out to be the 4.2 acres that they bought for the new Superior Court for Tuolumne County. And as I mentioned, in 2016, we constructed the Mother Lode Regional Juvenile Facility. In 2017, we constructed and worked with TCTA in regards to the Tuolumne Regional Transportation Hub. And then we also, to prepare for the jail project, we brought Justice Center Drive further from where it stopped, just past the juvenile facility, all the way up past transit, and then we put in the driveway for the future jail project, if you will. Then in 2019, as your board is aware, we constructed the J.H. Jack Dambacker Detention Facility. And also then the following few months after that, construction started on the Tuolumne County Superior Court. And that is a state project that they're working on with, as we heard last week, they anticipate moving into those facilities sometime this May. So here we go. So what this map is showing you is the Law and Justice Center as it stands right now. What you see on the very left-hand side is the Mother Lode Regional Juvenile Facility. You see Justice Center Drive going through that, snaking through the facility, and then you have in the middle of the project the 4.2 acres the state of California purchased for the new courthouse that they are in. Right behind that is the new jail project. So what we have right now are the three parcels that you see there right now that are not developed.
They are just vacant. They are proposed for development to bring the rest of the justice partners on the site. And then what you see on the other side, what you see in between those 3 vacant parcels is kind of a new road that will be going in there that will go up to Sanguinetti Loop. It hasn't been officially named yet, but what we promised when we bought the property, the Gardell family, to name it, to designate that this was part of the Gardella Ranch at one point in time. So we are looking at naming that road Gardella Ranch Road. The need for Gardella Ranch Road is really the Justice Center Drive was not designed or constructed to hold all of the capacity from this campus. So kind of right now, that's where we are as far as the Law and Justice Center campus. Is you have 3 vacant parcels, roughly about 7 acres, with 4 buildings currently on site. So where do we go from here and what the next steps? As I said in my board memo, the previous board had directed staff, because they kept asking, well, how much is Gardella Ranch Road? Well, could we sell off one of the parcels? What could we do? Or how are we going to fit on these 3 parcels? Or how much property is the 3 parcels and what's happening? And so it was really hard. Staff did not have answers to their questions. So they directed the county to work with an architectural firm and look at the best and most effective use of the rest of the Law and Justice Center campus. They wanted us to refresh the numbers. The space needs study, as we were just talking about earlier, is from 2005, and a lot has changed. As you just noted in that chart that I had up there, the 2 columns between the staffing only tells part of the story. So where are we? What kinds of services or programs have we brought on since 2005, now that it's 2021? And where are we going past 2021 and what's happening? Mo, how much is it going to cost to build Gardella Ranch Road? I didn't have those answers, and so that's why we hired Lionakis Architects to work with the county to come up with a programming document to help answer some of those questions for us, to be able to give your board enough information to then make some decisions in the future as far as what you want to see for this campus. So as I just mentioned, on March 2nd, staff will come back with Lionakis to present the full programming document that has been developed for this site and talk to you exactly about what our current needs are, what we have, what we're experiencing in the different departments as far as space needs and our facilities themselves. Talk about present some options for you in regards to how maybe to best use those 3 parcels that are vacant right now, and maybe get in a little bit about some of the possible funding mechanisms, or give some staff some direction as far as what you want to see out there. So with that is your background on the Law and Justice Center, more than you probably ever wanted to know. So I'm here to answer any questions. Staff is not looking at getting any direction from you today, but here to answer any questions you may have.
All right. Yeah, a lot of history there. A lot of past. I guess I'll go ahead and start. Supervisor Half.
I don't really have any questions. This is a walk down memory lane for me, because I was here this whole time as staff up until 2017 and actually got a tour of the jail facility before it opened. So I feel fully up to speed on this and know what it took just to do the space needs study, for example. What a huge endeavor that was. So I look forward to the next step in the next meeting, and I really don't have any questions.
Great.
Thank you.
Okay. Supervisor Kirk?
Yeah, I mean, you kind of answered it. We're just here to get information. We don't have I guess the only question I have is anything that we're doing up here saying today, are we moving forward with anything? Well, I guess what is the thought process? What is the next step? Now that we spent this money, done this study, we have a timeline on when this is going to be brought back for further discussion, for action, or?
Yes, so what we'll do is on March 2nd, we'll come back with a full programming document that Lionakis has put together and present to you some recommendations in regards to, well, you'll get a full assessment. Just like you saw that was done in 2005, we've updated everything, and we've met with all the departments and discussed their concerns, their spaces, what's working for them, what's not working for them. We will look at the 3 parcels that are currently vacant that you see on the campus right now, and Lionakis will present you with some options and with some costs that are associated. If you were to take option A, for example, it probably will cost you about X amount of money. To build, you have options regarding Gardella Ranch Road. We divided the road into 3 sections, and so whatever you want to do as far as developing that. What we'll do at that point in time is probably stop at that as far as the next presentation. There is probably going to be a 3rd presentation, because financing this, well, deciding, staff needs to hear where the 5 of you are in regards to what we want to do as far as the next steps. And financing is a huge component of that. And timing is a huge component of that. And so what we want to do is look at some, spend some time after we look at some of the options for this site, and spend another meeting probably talking to you about financing and options, and what does it mean if we do something now? What does it mean if we do something later? What is the best way to go in the future? So that's kind of what we're looking at.
Yeah, and I think, just from hearing what you're saying, I think it would be good sooner than later, and it sounds like we just need to get all the information. We do need to find out where this new board sits as far as moving forward on this, because I know I have some major reservations on some things, and but I also, there's some really good points. I'm a firm believer in why are we leasing when we could be owning, and I get that, and collaboration, like you said, with some of these departments, I get that, one-stop shopping for customers, but there's some concerns for me as far as trends with the justice system overall. The sheriff's office, I'm looking at this, back in 2005, they had 99 deputies. Way more call volume now in 2021, it's only 85. So on the streets, we're getting way more call volume, but in the justice center, way less lockups, juvenile trends going way down. So we need to have a serious discussion about what the future of the criminal justice world looks like. We live in California, and so I'm all for getting all the information, but I just don't want to spend too much time going down too many roads until we all know where we sit as a board. And I know that's where we're heading.
And that's exactly why staff wanted to do this presentation and break it up a little bit for you, to make sure you understand the history and where we came from, and then really talk about different options, but not ask you too many recommendations, because then the other half is coming back and looking at the financial component of this and gain some more advice maybe from some other people on how best to structure it if we wanted to proceed. The other thing that we as a county are going to be experiencing is as soon as the Superior Courts move out of both the Washington Street and the historic courthouse right next to us, those buildings then revert back to the county. And so how do we want to make best use for that is another component that will be coming in front of your board sometime this spring or summer.
Eric Earhart, County Administrator's Office. I just want to add real quick, one of the hopes that we have with making this a 2-part presentation is that between now and the next presentation, that if you haven't already had an opportunity to tour fully these facilities that we're talking about and seeing which ones are owned and which ones are leased and seeing the condition that folks are working in, we would encourage you to reach out to Mo or myself or even the department head and take that opportunity between now and March 2nd to really see what we're talking about. When we talk about, we used to, the DA's office used to be a church or a library or some of the other spaces that we lease. So we would just encourage you to do that as well. Thank you.
When we do have that next presentation, can we make sure to include this chart?
There will be a new and improved chart.
similar with this information?
Yes.
Okay, thank you.
So it'll have, so Supervisor Kirk will have all that, it will have all the same categories, but updated information. Because it was amazing when I went through that chart, the difference. I almost included in here, but I needed to stick to the past. But it's drastically different as far as the needs and what's happening, absolutely.
Mo, thank you, and I think it's a good idea to be able to split up this conversation as well in the presentation. To me, I think there's definitely some efficiencies that could be gotten as far as just making it easier for staff, all the justice staff, to be able to work together. But the bottom line for me is cost, and how do we avoid potentially what could be a costly kind of capital project and how we finance that. And it seems like it has the potential to save us a lot of money, because I've seen some of these leases and they're huge. Tracy shared some with me from some other staff departments. And like Supervisor Kirk said, why lease when we can own? But on the other side, we're signing our name to a pretty expensive project. So looking forward to that discussion. I just wanted to ask quickly, in your estimation, if everything lined up and we were able to find some funding in what would you consider a normal time frame with that, going through the entire process, the board all supporting something like this, what would be the nearest time that we'd see something developed on one of those parcels? And I won't hold you to a month
Yeah, I was
commitment or
gonna say
anything.
thank
Just
you.
a range would be great.
So probably
3 to 5 years, or
yeah, I would say easy, 3 to 5 years. The one thing that you gotta take into account, and that's why I mentioned it, was the core permit. So the core permit alone, it's cleared environmentally, the whole entire 48 acres, but we still have to go back and do some more due diligence and do that core permit, and that'll probably take us 7 to 8 months to do the permit. But there's other things that can progress during that time, selecting and working with an architectural firm, working with, the biggest thing that I found working on buildings is really engaging and working with your clients. And so for me, my clients are the sheriff, the district attorney, the probation chief, and the public defender, and really listening to them and trying to find out what they actually really need and how can we, I think you'll be impressed with what Linacus did, and they're just listening to them in the programming document, looked at those efficiencies. So we don't need to build 5 conference rooms that are this size. If we have one for the campus, then that's great. That can be reserved from different people. Those are the things. What about shared lobbies where we can, or what happens with having, being able to do, one of the questions that we'll have is to try to look at debt service. And I'm sorry, I should not be talking, this is coming next month, but, looking at the possibility of a food court. Will that pencil out? Will that help us be able to pay for some of the debt service? So those are the types of things that you really need to put together in a strategic plan, as if that's the direction that that your board wants to look at as far as with staff, and put something together for you.
I appreciate that. Like Eric mentioned, being able to get a chance to tour the sites. I got to go walk through the jail, the opening there. It's a very impressive facility. I'd like to be able to do the same for the courthouse, but to be able to learn more about that, and I think 2 weeks, hopefully, to do a little Wikipedia research and be able to know what questions to ask for the next meeting. Just checking for those 3 properties. So they're county-owned land.
They're county-owned land, and you're probably, one of the things that we didn't talk about is why. So, for example, you see the black dotted line, especially at the bottom of that map. Why didn't we use more than that property? Why on the one side of Gardella Ranch Road we only have that square designated for building? Again, you got to remember that site. It's Tuolumne County, so the topography plays into it. There are also on this site cultural resources that we need to stay away from, and so what you see here depicted is the best and most usable parcels of that site that remain to be built on. We also have a huge area along Highway 108 that is the Caltrans right-of-way. So if they ever wanted to expand in the future, they have reserved a good 50, 100 feet, I can't remember how much, of property that we cannot build on. So that's why like the juvenile facility is set back from the road. And we don't want to have anything up against the highway.
And this site was chosen because of its proximity to basically, you know, normal resources, infrastructure, and roads, right? So it's
Right.
access.
Mm-hmm.
And it's not surrounding any residential around it?
No, the closest subdivision you have is Lambert Lakes, that is up on the hill a little bit. It's
pretty far away.
Yeah. One thing that was nice, we did a lot of, when we were considering purchasing the property and when we did the hearings for the environmental impact report, we had only 5 people get up and talk. Of the 5 people, one was kind of concerned that if we did or built this campus on the other side of 108, we were encouraging development or businesses on that side of 108, and if we did it, others would come. Then we had one person who was neutral who said, well, it's nice, I like the concept, but basically you are, the viewscapes, you're ruining my viewscapes. When I drive down the highway, I want to be able to see Yosemite National Park. I'm like, well, if you're driving, how can, you should be looking at the road. But anyway, and that's why we really looked at spacing out the buildings and why in the environmental impact we talked about viewscapes and not having huge blocks of buildings on top of each other. And the other components were the attorneys in the community. They were concerned with building this Law and Justice Center. Right now, all their offices are downtown, and they're able to walk to court. And so if we built this campus, where were their offices going to be? And, we toyed with the idea as far as county staff in providing offices on this campus. But you know what? We stepped back from that because that's probably something that the private sector should be looking at and providing some opportunities for them to maybe build some buildings for attorneys' offices or bails bonds or stuff like that. The 7 acres that we have remaining on the site are really going to be tight for the programs and services that we want to put on it.
Great. Thank you, Mo. Appreciate it.
You're welcome.
I just had a question. So we're cleared for the environmental permits for the 3 remaining sites in addition to the ones that are already there, right?
Right. So all 48 acres were included in the environmental impact report.
Right.
And in that report, we designated all the things that we're considering for the site were put into the environmental impact report. So there's no augmentation to that report. There's no additions that need to be made. We told them way back when that we were going to put the Justice Partners on this site, including transit. So. Okay.
And the specific question I had around that is there any sunset period for an EIR that would apply okay. And then in a more general sense, are there any deadlines that we're working up against on utilizing these 3 sites that would make it more advantageous to make a decision sooner rather than later, or are we still kind of?
So, not at this point in time. You will see in the second presentation as we go through the options and you start looking at the estimates that are being presented by Cummings. Cummings is a construction estimating firm that I asked for 2 different things for you. I asked for a cost estimate point in time right now, and I asked them to look at 2025. So you'll be able to see there's no immediate, to answer your question, Supervisor Campbell, there's no immediate need to make any decisions, but I wanted to give you the opportunity that if we built now, or shortly after that, what would be the cost, and if we didn't build until the future, what would be the escalation for that? And I did that because of my history. It was amazing. Back in 96, we had received a grant from the state of California for $7 million to do a tri-county juvenile facility down at the mine site. And at that point in time, we were going to build a 60-bed facility for $7 million, all the infrastructure and everything. Well, here we go. That didn't come to fruition. We had some issues with that, had to give back the money. We tried again, as we just mentioned here, so speed up to 2016. Well, we were able to build a 30-bed facility for $16 million. So construction escalation is something that your board needs to consider, along with so many other factors when we start talking about the next steps. And that's why, you know, probably there are firms out there that are construction financial advisors that can really assist us if that's something and direction we want to go, that could maybe help us look at what is the right timing and what do you have available? What are your resources? What's the best method to finance it? Or you know, right now the climate for construction might not be the best. You should wait till this point in time, or now is a good time, and you probably shouldn't put it off. So those are all considerations, but there's no immediate timing on this.
Yeah. Okay. I'll look. Any public comments? Okay. Any other comments from the board? Okay. And I'll just wax philosophical just for 1 second, if you'll indulge me. And it's that,
yep.
You know, I don't get a lot of, I don't think I've ever once heard from constituents that they want more public buildings. But what they do ask me for is to save money. They want me to find ways to save money. And, and I you know, I don't know if building buildings out there will do that. They are very expensive. But if there are ways we can get rid of some of these leased properties and incorporate them in a more condensed area, we should definitely look at that. And if we're talking about, you know, replacing leases for tens of thousands for the cost of construction in the millions, you know, we really got to find out whether it makes sense financially to do that. But, you know, I really think we should look at that. It's absolutely, you know, right. Where you spend $2 now to save $5 tomorrow,
right.
Kind of thing.
And there are a lot of components in regards to, you look at the maintenance and the stress on our staff to take care of these aging buildings, and the money that we need to budget every year just to keep some of these older buildings together is also needs to, another component of looking at that, as far as looking at whether it's economically feasible to stay the course and stay where we are, or do we want to move forward with our plan?
Yeah.
So.
All right.
I hear you.
Thanks very much.
You're very welcome.
Okay, so we'll go ahead and move on to our closed session items. So I'll look to the clerk to read those. So items 16, 17, 18, and 19.
Number 16, closed session, conference with legal counsel, existing litigation, Authority Government Code Section 54956.9 D1, David Lee Brock v. County of Tuolumne et al., United States District Court, Eastern District of California, case number 117-CV-01610-JLT. Item number 17, closed session, conference with legal counsel, existing litigation, Authority Government Code Section 54956.9 D1, East Bay Restaurant Supply, Inc., v. County of Tuolumne et al., Tuolumne County Superior Court, case CV 63504. Number 18, closed session, conference with legal counsel, initiation of litigation, Government Code Section 54956.9 D4, one case. And item 19, closed session, conference with legal counsel, anticipated litigation, Government Code Section 54956.9 D2, one case. Letter received from law firm Shute, Mahali, and Weinberg, LLP, dated January 26, 2021, attached as part of the agenda packet.
Okay, I'll look and see, do we have any public comments on those 4 items? Okay, we don't have any public comment on that. I'll look to county council. Do we anticipate a report out? Okay, so there is a possibility for a report out of this. Okay, all right, so we will, we'll go into closed session and we'll stay in this room, I believe, right? Yeah, all right, thanks very much. Good, Heather? Okay. All right, so we're back from, I need another board member. One of them just walked out. Okay. All right, so we're back. From closed session, the board directed county council to correspond with the law firm of Shute Mahali and Weinberger regarding their January 26th, 2021 letter alleging a Brown Act violation. All right, so we're ready to continue on with the regular agenda. I think we were on. So we're on item 11, and I'll look to the clerk to read that item for us.
Okay. Second reading and consideration of adopting ordinance number 3387, amending ordinance 2.52 to add section 2.52.060 to formalize health and welfare benefits to board members as set forth in the executive and confidential compensation plan.
All right.
Second reading of the ordinance for the Board of Supervisors benefits. I'm going to take this off while I'm talking because my glasses are fogging up and I can't see. So during the last board meeting, we had brought an item to the board about formalizing the benefits for the Board of Supervisors. And this is just the second reading of that. So what I will do is read the item that specifically pertains to the board benefits as outlined in the executive confidential compensation plan. And I'm getting out the wrong memo. So the annual salary of a board member includes the basic salary as set forth in section 2.52.010 and such other health and welfare benefits authorized by Government Code Section 532,000, which are provided to non-board members, elected officials, as set forth in the Executive Confidential Compensation Plan, such as medical and dental benefits, optical plan and group insurance, and other health and welfare benefits, retirement and deferred compensation benefits. This is the second reading, and as such, it would become effective 60 days after today, should your board approve it.
Okay, any questions for staff? Okay, I just had one or two, same questions I asked the last reading. Does this increase benefits for board members?
It does not.
And does this provide more transparency into board benefits for the public?
We believe that it does.
Okay. All right, I'll look to see if there's any public comments. Okay, don't have any public comment. I'll look for a motion from the board.
Motion to approve.
Okay, a motion from Supervisor Brandon. Do I have a second? Second from Supervisor Half. All those in favor, please say aye.
Aye.
Aye. Opposed? Abstain? Okay. Vote is 5-0. Okay, so we'll move on to item number 12.
consideration of approving an agreement with Ascent Environmental, Inc. for $250,000 per year for botanical services of record related to the Tuolumne County Master Stewardship Agreement and authorizing the county administrator to sign.
Hello.
Okay. Good afternoon. My name is Simi, and I'm with the Office of Emergency Services. I am here today requesting your board approve an agreement with Ascent Environmental for $250,000 per year for botanical services of record related to Tuolumne County Master Stewardship Agreement and authorize the county administrator to sign. In December 2017, the Tuolumne County Board of Supervisors approved a Master Stewardship Agreement with the USDA Forest Service, Stanislaus National Forest, giving the county authority over the next 10 years to work with the Forest Service to conduct landscape restoration activities on the Stanislaus National Forest within the boundaries of Tuolumne County. The purpose of the MSA is to increase the pace and scale of restoration and fuel reduction treatment to make the forest more resilient to fires. The county was awarded nearly $10 million in direct allocation from the USFS to aid in this partnership effort. One of the identified needs was for the county to hire botanical services to conduct targeted botanical surveys within various project boundaries in preparation for forest treatment activities. Therefore, in October 2020, the County of Tuolumne released an RFP for professional botanical services. We received 8 responses. Upon reviewing and scoring all the proposals, the team concluded Ascent Environmental was best suited to provide the services based on evaluation of qualifications, approach, and cost. The contract is for $250,000 per year for the next 4 years. Ascent Environmental will be paid by grant funding from the Forest Service that the county received. There will be no impact to the general fund. Specific project needs and costs will be developed on areas the Forest Service and YSS identify, and those will be detailed in task orders. It is recommended the Board of Supervisors approve an agreement with Ascent Environmental Incorporated for $250,000 per year for botanical services of record related to Tuolumne County Master Stewardship Agreement and authorize the county administrator to sign. If you have any questions, I'm happy to answer them.
All right, thank you very much for that report. Any questions from the board? Okay, Supervisor Brandon.
Hey, Cindy, thank you for presenting on this. Just to double check, so this is all from grant funding, right? Not general funds or taxpayer dollars here?
Mm-hmm.
And also that it is a kind of an environmental report on botanical services. This is in preparation to be able to do the fuel reduction and potential like logging of a site, right?
Yes.
Okay.
So it has to do with pretty much restoring the forest and field reduction treatments and projects. So it kind of goes hand in hand with various other projects under the MSA.
Great. Well, thank you. And yeah, I mean, this I think hits on, we'll probably talk about later, fire, reducing fuels, and also being able to create some economic activity in the county. So win-win-win. Thank you.
Okay.
I'll just say thank you for your work. And the money's coming from U.S. Forest Service through the MSA, but it's just a great example of how this MSA is picking up funds from all over the place and making it happen here in Tuolumne County. So just thank you guys for your work and the boards before us and Ryan at the beginning. And it's just cool to see things keep getting added. Thank you guys.
Yeah, it's been a long process, and that's what it takes is persistence to get the money in and get to the point where we're actually doing these projects. So good job. Looking to see if there's any comment. Okay. No public comment. I'll look for a motion if there's no other comments or questions.
I'll make a motion to approve the agreement with Ascent Environmental Inc. For the botanical services.
Okay.
Second.
All right, motion by Supervisor Goldenberg, second by Supervisor Brandon. All those in favor, please say aye.
Aye.
Opposed, abstained. Okay, motion passes.
Thank you.
Thank you. Was that your first presentation? Oh, well, great job.
She's a huge introvert.
All right, well, we're on to item number 13, and I'll look to the clerk to read that. You've got a tough act to follow, though, so.
Whew, all right. Yeah, come on, Simi. Consideration of approving board goals and objectives from the 2021 board workshop and strategic planning session, and provide direction on the 2021 Tuolumne County Board Governance Manual.
There we go. So Tracy Riggs, County Administrator's Office, and I have removed face covering because my glasses fog up and I can't see, just so you know. So today we will go over the results of our board workshop. As your board is aware, we did miss the one in 2019, and I think everyone was happy to be able to participate in this process again. The board workshop took place on January 20, 21, and 22nd. The first 2 days were located at our Tuolumne Memorial Hall, and the final day was at the EOC Office Striker Court. And we're just waiting for our presentation here. So today we also shared, if anyone wanted to look at them, some of the brainstorming activities that took place during those 3 days. The first day we had the 5 board members and county council and myself, and we spent some time going over some leadership principles, getting to know each other better, hearing what your priorities are. On the second day, we had all our department heads come in, and we were able to spend some time one-on-one where like 6 to 7 minutes where you got to talk with pretty much everyone in the room. And then we did some presentations so you could hear what is it that they're currently working on. And then on Friday, we then just met again with some, the 5 board members, county council, and then some members of my office as well. So we could hear how it came together for the final day. And then ultimately a culmination of some board direction, goals and priorities that you will make a final vote hopefully today, and we can start moving on those. I do want to make sure I state that, sorry, I'm getting a little distracted here. When we decided to do this, when we chose the Tuolumne City Memorial Hall because it was a larger venue, we did follow the physical distancing. We did everything we possibly could to make sure we maintained that 6 feet wherever possible, and that we were all wearing our face coverings, and there was hand sanitizer that was available on the table. So we did everything we could possibly do to try and ensure that we kept each of our coworkers safe. And they're still working to get our presentation up. So there in the board packet, I had given you some documents. One of them was the draft governance manual. The draft governance manual was also provided to you during when we did the board workshop. It was actually posted on the agenda site so that other individuals who might want to look at it could. That draft, a lot of counties, it is consistent practice that counties have a governance manual. I actually, as much as I'd like to take all the credit for writing that up, I can't. My colleague, Patrick Blacklock in Yolo County, I stole it from him, and then he told me where he stole some of it from. So this is where we can say, I can plagiarize and not get in trouble for it now. But I do want to make sure to put out a shout out to Patrick for sharing that with us. And Kathleen was the one who had attended one of his classes in the New Supervisor Institute. And if you weren't in there with Kathleen, Patrick is a fantastic CAO and he does a great job. So thankful that he shared that. So that will be something I'll hit on while we're talking today. The other items that were part of your packet were the board goals and objectives. As we had on Friday when we left, your board had asked me to reach out to department heads and get their feedback. So the second item that was red line, so you have one that was as it was on Friday afternoon. There's another one that has some red lines, and it's in goals and objectives 4 and 5, and we'll hit on those today. So with that, we'll go ahead and get started. So the purpose of our workshop was to engage in leadership, governance, roles, expectations, and resource conversation in order to make informed selection of board's top priorities for the year. And I only hit on this because I've had a lot of questions about who was our facilitator. You guys have seen these, but Patrick Ledden was one of 3 or 4 people that Supervisor Campbell and I interviewed on the phone. I actually had come across Dr. Ledden on LinkedIn. He does a lot of leadership. So as you can see, there's some information about him. I've had a lot of compliments from both department heads and from some of our board members who enjoyed having him there. And I'm thankful that he was there to facilitate these conversations for us. So this is what our agenda looked like. I kind of already went through that verbally, where we talked about what we did on each of those days. And some took longer than others, and there were some components we didn't get into, but that's okay because that meant we spent time talking about the things that was most important to your board. So we began the conversation, and I'm hitting on this because you know, especially Supervisor Kirk and Campbell know that organizational culture is something I'm just passionate about. It's something I hit on when I initially interviewed for the position, and then in my evaluation each of those times, it was something that I really wanted to try and influence. Anytime an organization has some instability related to financials, layoffs, and it's been a continued process, which I feel like that's what we've had since I was brought in 2006 to help close the hospital. So I've had a lot of experience working in different departments at various levels of the organization, and knowing how staff were feeling, I really was trying to figure out ways with our executive team and everyone else that they work with, and how can we address organizational culture. So I kind of hit on this where you see where Ram Charan shares that the culture of any organization is simply the collective behavior of its leaders. That if we want to change the culture, we have to change the collective behaviors of our leaders. And we've talked about that, about where, you know, no one likes the idea of leading from top down, but if we can't emulate what it is that we want to take place and the behaviors that we want to see in others, that it breaks down immediately. And we talked a little bit about this. And then Stephen Covey, if people have not read some of his work, he has done great work in leadership as well. But everything starts out with the individual, because all meaningful change takes place from the inside out. So if we want systemic organizational change, we have to do it at the individual level. And again, I think that comes from building relationships with our coworkers and really learning what it is that the organization values when it comes to looking at culture. So we talked about 3 levers for change from the inside out, looking at what's the why do we want to change, why would we do that, why would we spend so much time on it, leader modeling, which we've discussed a little bit, and then skill and capability development, which your board has made a priority again in this year's board goals and objectives. And we talked about trust. We know that that trust only comes through relationships. So I'm not going to read through all of these, but these are some of the things we did hit on. We talked about trust is confidence, having confidence in the individual that you're building that relationship with. It's also about character and competence. And then we talk about that smart trust, where you go into it with your eyes wide open. You're not being gullible, but you're not going in with distrust. You're giving an extending what I would call some grace as you're learning that process with a new individual or with someone that maybe you've had a relationship for some time and you're still working through the process. So we talk about high trust culture is built on the credibility part is that integrity, intent, capabilities, and results. And I'm not going to read all of the 13 behaviors of high trust leaders, but we know they're direct. They have clear direction. We've talked a lot about transparency even in this month. Loyalty, extending trust, letting people do their work without that micromanaging. So lots of things that we're all working on, especially over these last 2 years that I've stepped in the role with our executive team on changing the culture of our organization. Then we kind of got into governance. We didn't get into this as much as I would have liked. I only have a few slides on governance, but I do, for those who are listening, I do want to read this because some people don't always know what governance means, and so I'd like them to kind of hear a good definition of it. This is in your the draft governance manual. So it says governance is the act of transforming the needs and desires of the community into policies that direct the organization. As the governance team fulfills the responsibility of of setting direction related to policy, budget, and finance, human resources, collective bargaining, facilities, and advocacy. The way in which the governance team members perform the role is critical. And governance begins with the board. Again, this is all in the manual that is also online if individuals wanted to look at this. But whether, our board is setting that initial tone, right? Everything's going to happen, everything that they're watching the board members do. So we talk about what happens in the boardroom, in the community, at home, that the board members are always the stewards of the county, that a regional government provides countywide services to all of our residents, municipal services to residents in unincorporated areas, and state and federal services is a political subdivision of the state of California. And there's lots of conversations that we talk about the programs we administer on behalf of the state and federal government. And that the integrity of the county is dependent upon the responsible and professional manner in which each board member and the board collectively fulfills that governance role and responsibility. The demeanor of governance team members sends an important message to employees and public. So kind of just from the board, that goes down even into your appointed department heads. How we conduct ourselves on behalf of how we represent the board is equally as important as that statement for those that you appoint. And this continues on. I'm just going to read the yellow part instead of reading everything out here. But the community elects board members to set and monitor the direction of the county with a county administrator who translates that direction into action. And we talk about this a lot, that you have department heads who I always tell them they're the experts in the field in their departments. So just like you might rely on me to set forth policy, I'm relying on them to continue being the expert in the field so that we can rely on them for their recommendations that back to us of what the policy should be and how should it look. And then effective governance. I'm not going to read through this whole thing, but the 4 fundamentals are mindfulness, focus, manner, and preparation. And this goes into more about maintain unity of purpose. Unity amongst the board is incredibly important. Governing within the role as a board, and creating a positive governance culture and structuring work for effective governance. This one we did hit on a little bit, and we've talked about this, is we know there is some overlap. So we always have this conversation about, is the board getting into the weeds? Well, there's that overlap area where you see, where we have the board who does the visions, the priorities, the policies, CAO and staff who are more of the technical experts. But in that middle, when we talk about strategic goals and we talk about success indicators, those are done as a team. And I think that's exactly what we engaged in during the workshop. And this one, Supervisor Brandon and I were just talking about this one yesterday. So again, you see that wavy line. There are times when we're going to kind of go a little bit deeper at times with board members, especially when there are areas that you are passionate about. But in here, you'll see it says, the board sets the direction, establishes a structure to implement that direction, hires a county administrator, adopts a budget, and adopts a strategic plan, supports the staff as they implement that plan, holds the system accountable for implementation, and educates the public on the goals established by the board. But as you look at this, we have up on the top, which is where the board is, of setting directions. We talk about that again, that the accountability and that structure, that the board is the one who guides and sets that in place. And then on that bottom part is where you start getting more of the technical competency, where I talk about our experts in the field are our department heads and their staff. They know what they're doing, and we depend on them a great deal for that information to come back so that your board is aware of where we might have deficiencies, where can we be better, or even just some creative ideas to meet the needs of our community. So here's where we get into the meat of this. Again, you have copies of this that was provided online. This is what the board left when we left on Friday, the consensus of the board. There was no approval during that. We were directed to work with department heads to come back. I do want to talk through these for anyone who might be listening and not necessarily watching right now. So we had 5 board goals, and then we have objectives in each of those goal areas. So what we've talked about is the board does the how and the what and the why, and we do the how. So when I did put these out to our department heads, what I got back was a lot of the how, and we'll get into that a little bit later. But the first one was, and this was our number one priority for the last several years, and I think everyone knows why that is, but this board went a little bit deeper so that we would know what does success look like according to you. So prevent loss of life and reduce property damage due to catastrophic fire by creating a strategic plan for wildfire preparation. So the objectives under that goal are the first one, 1.1, reduce risk through fuels management on public and private lands. 1.2, secure sustainable long-term funding for fire protective services and vegetation management. And 1.3 is foster community participation and engagement in fire prevention and education measures. Those might seem simple, but I can tell you, I have department heads who gave me one was almost 2 pages of just creative ideas of how we can achieve these objectives. And we'll come back to that later, but there's so many ways to get to those objectives that staff could probably work on these objectives for years and still have more to do later. The second one was community and family health. The objective 2.2 on that is reduce the negative impact of COVID-19 in our community and advocate for local control. We talked more about that earlier this morning. 2.2 is address emergency needs in homeless communities and collaborate with public and private partnerships to combat homelessness. Number 3, which is the third priority, implement economic planning and development efforts to meet current and future community needs. Objective 3.1, develop policy and coordination of activities to improve broadband accessibility. 3.2, align zoning with general plan to streamline housing and commercial development opportunities. And 3.3 is explore creative land use and zoning options to provide greater flexibility. And then number 4 and 5, 4, modernize government and increase effectiveness to better serve the community. 4.1, maximize OpenGov utilization to automate and streamline processes. 4.2, improve website functionality and usability to enhance user experience. And 4.3, recognize the value of employee development and encourage professional growth to serve the community, to better serve the community. Number 5 is roads and infrastructure. So 5.1, advocate for and secure funding for roads and infrastructure improvements. 5.2, road repairs with emphasis on increased ditching, roadside brushing, and hot patch. 5.3, implement a road repair and construction strategy. 5.4, update capital improvement plan to better manage deferred maintenance requirements. So one of the things I want to say on those 5 goals and objectives is staff reminded me that there's a lot of work already going on in these, which is fantastic. It just means that where the departments are already feeling the need and the pressures from the community, your board validated that and you help us drive it forward. And that's a huge need that staff need for that direction. So the next slide is really where there were the only place that we had department heads who are recommending changes to either the goal or mostly its objectives are in 4 and 5. So in 4, you'll see a little bit changing. The 4.1 is really to talk about transparency, which is where and I agree that your board is very focused and OpenGov, one of the things that it does provide for us is transparency. That was why, I saw it years ago as I've relayed and fell in love with the budget software because of the ability for a user external to our organization who can go in there. If they want to look at roads, they can look at roads. If they want to look at fire, they can look at fire. We want to continue with this. So I do like the added language of transparency. And then we added a 4.4, update internal policies to ensure objectivity and consistency in personnel and business continuity. Your board heard from department heads about how outdated some of our policies are. Some of them 20, 23 years old. So we're in the process of doing some of those already, but we are asking that your board would consider this one of the objectives when we look at modernizing government to become more effective. And then finally, for roads and infrastructure, what came out was infrastructure, when you see this, is is in the idea of that your staff within the organization are part of the infrastructure that delivers the services to the community. So this is develop employee recruitment and retention oh my goodness, I'm so sorry. Develop employee recruitment and retention strategy to better serve the community and meet board goals and objectives. You heard from several department heads, and I've been relaying to you as I meet with you that we are having a very difficult time recruiting and retaining. Sometimes we get some classifications, no one applies for them at all. Or when they do apply, they don't meet the minimum qualifications. So what your department heads would like is that we would like to put together a recruitment and retention strategy that we would bring to the board for your consideration later in the year. So what I'm asking from your board is that you would approve board goals and objectives, that it can be, you know, the first set that we gave you, or the first slide of the board goals and objectives with that second slide that shows you 4 and 5, that the recommendations from your department heads. And then when it comes to we want to work on a strategic plan. Once you approve the board goals and objectives, then I'll begin working with the executive team on creating a strategic plan of how do we accomplish those board goals and objectives. And we start putting some timelines to it and some ideas to it. We bring it to you and we have that conversation and listen to what ideas that you may have and in addition to what your department heads will recommend. The other one is that draft governance plan that I had sent out to you. It is kind of a long plan. Most of it we are already doing, but it does speak to a lot of the process of how you as board members, you know, how you come to your board meetings, how you conduct yourselves with each other. One of a couple items, if you've read it and you approve the plan how it is, direction that I return at another future board date so that your board could approve it as a formal plan. If you have not read it, or there are some changes or there are some changes you would like to see in that draft governance plan, what I'd like to do then is I can do a couple things. I can work with you individually on those to go through it and talk it through, or we could set a workshop in the near future to go through it as a united body so that you can discuss those things. And with that, we're open for questions, comments, anything that you might like to see different, and we look forward to the discussion.
Okay, I'm trying to think, maybe we should just start with that first question that you asked about whether we should hold another meeting for the draft governance plan. I think, is there consensus there that we have? Okay, so.
I'm sorry, does that mean a workshop, or you want me to bring it back for approval? Which is your?
Would we want a full workshop? A workshop?
I had mentioned to Tracy yesterday, just something to bring up. Maybe it would be good if we all read through it, and then if there's things that we think would need to be addressed or specifics, then we give that to her, and then she brings that to the full board that way. I mean, because a workshop could last 8 hours, or if we get specific with her and say, I want to see these things changed or these things addressed, then that meeting could be much more focused on what our suggestions are instead of just kind of an open, just trying to be more efficient.
Yeah, I honestly, I do tend to kind of lean that way, that it wouldn't necessarily need to be a full workshop, since essentially what we're doing is editing a document, and that's kind of an individual process that I'm sure we'll all do sort of on our own. But I don't know, I'm open to.
I guess I'm thinking maybe a blend of the two. Definitely we should read through it, and if we have some ideas, you know, send them your way, but then have like a mini workshop so we can have some, you know, time for discussion. You know, I don't think it needs to be all that long, but.
So maybe we could set it as a part of the regular agenda, but a full appointment. So something like.
And I think sharing that with her, she'll probably be able to understand kind of how that communication will go. You know, she'll have all of our individual ideas, but then based on the discussions with us, she'll know how to direct the conversation.
Yeah, that would be my only concern, is that we don't use up too much time of a regular meeting trying to go back and forth too much is the concern.
I agree with Anaya. I think that's an efficient way to go about it, but then like Dave mentioned, I would still like, once we have that draft, to be able to return and discuss it and see where maybe most of the changes were kind of oriented at, and if there were a few things that were unclear, because we might make recommendations that can't be put together.
So maybe get all of our intake and then post that on the agenda so we can all look at each other's suggestions coming to the meeting.
Would is that okay?
That way.
Okay, that would be great, actually.
I'm seeing his ideas, their ideas, and then we'll know what to talk about when we get to the board.
Okay.
So.
Is it a Brown Act issue?
No, it's not Brown.
Okay.
I'm not even going to get to the technical part. We'll figure it out. I'm just trying to think if you,
Well-
for example, if all five of you comment on one paragraph, that could get kind of, but we'll figure it
Okay.
out. And I can
Well-
also sit with, two at a time even to kind of go through it.
Well, you're the pro.
I'll figure it out.
What's the recommendation that incorporates?
No, I
some of
think what
these
you
that might-
said is fine, and I'll work through the process of how do we do that in something that is legible for you once all those comments come in, and we'll work through that. It'll be fine.
Okay.
So can I get a clarification? So we're talking about the governance document.
Yes.
And in the governance document is so far our strategic plan. And I know during our 3 days, actually the third day when we developed the strategic structure, we were also starting to get into the how. When you're talking about meeting with department heads, is that when you're talking about getting into the how?
Yes, so I actually updated the governance manual from the one that's posted now is not the one that was posted when we did the workshop.
Right.
So all it does is refer to a strategic plan, and that strategic plan will be our guiding document as we set priorities, resources, and stuff like that. So you could approve the governance document by itself without having the strategic plan done first. But the strategic plan, yes, is how we're going to get to the how. All of those recommendations from your department heads, along with the timeline and resources needed in order to accomplish what the department heads are recommending.
So ultimately, this is my question, ultimately, the strategic plan will have bullet points, which will, underneath each number, which will be the how we're going to get that done. Is that correct?
Yes, it'll be, because I'm Kathleen, you're laughing. I'm Excel, so I'm thinking a matrix.
Okay.
With some timelines and stuff like that that will go out from each of those.
Yes.
We can have what is it that they want that the department head recommends, and then a timeline of what are each of those areas like that we need to do, because some of those, they'll take a process.
And at what point will the board be able to weigh in on those? Because we discussed some of those. We started to get into some of those, and I would like to be able to have also an opportunity to comment on those as well as the department heads.
I'll work through that with each of you.
Okay.
So once we have it, we can start coming to the board and working on it together, just so that you're not seeing it in its final draft, and so that you're not taking apart what everyone has spent so much time putting together.
Exactly.
Yeah.
Thank you.
Yeah.
Maybe your idea of some sessions, 2 people with you to kind of blush through some of those might have some merit.
Well, yeah, she's speaking strategic plan. She's not speaking about the governance plan.
Okay.
So, yeah.
Yeah, but on the governance.
But it might.
You could have, each of us could have a different idea.
Mhm.
Like you said in one paragraph, it might help to
Yep.
flush those out.
Assign us a color.
Yeah.
Seriously.
Well, and I'm thinking there won't be, I mean, are there any crazy changes? We're well, I guess definition, well, I guess we'll have to see.
It's
So-
fine. I'll sit with each of you, get your input on it. And it's likely that there'll be pretty common concerns or questions, and we'll address those, and I'll bring it back.
Okay. All right, so that was the first part.
That's the first
And then-
part. The second are your goals and objectives.
Yeah, so then I guess the question would be whether we adopt the amended with department heads or continue with the original.
Yeah, and of course, that staff recommendation would be that you would do the amended with your department head input.
Yeah, we're
Yeah.
focusing on, yeah, go ahead, Jeremy.
I got just 2 things with that, with the amended version. I think the language, and can we bring it up real quick? The language in the first part, I think, is improved overall, but actually the word improve, I think, is kind of too broad. To me, at least with the discussion, streamline was the correct word, was to make things more efficient. I think improve can mean a lot of different things, but the goal was to make everything more efficient. So I would say keep all the rest of the changes in the first, but would recommend replace improve with streamline.
The rest of you, okay. All right.
Good.
And then the other main ones was, was with 4.3 and 5.5, the new 5.5. They seem to be saying the same thing, and I also don't know if 5.5 makes sense under roads and infrastructure, unless it's only trying to do employee recruitment and retention for one department. Really, I think what we discussed, that this is a countywide issue, and that's why we include that as the increased effectiveness to serve the community, recognizing the value of development and encouraging professional growth being part of the root of how do we increase retention and become more attractive to work here. So my recommendation is to strike 5.5. I think it's already encompassed in 4.3.
Yeah, I respectfully, I think your department heads disagree. They were pretty strong on that, but that's up to your board what you would like to do. You could move 5.5 and make it 4.5. If it feels uncomfortable being, again, they were looking at infrastructure of the organization is why that got put there, but it could be moved up into 4.5, for example.
Of the organization specifically for roads and infrastructure?
Yeah, where it says road and infrastructure, they were thinking infrastructure of the county includes your county staff.
Right. I'm fine with either or. It does make sense to be 4.5.
Yeah, we can do that easy.
Right. I think roads is roads, and modernizing government is getting our employees and
Okay.
process. So
Is everyone good with
keep
that?
it. Just move it.
I'm looking for, okay. So we'll change the 4.1, get rid of improve and put streamline. We'll move 5.5 to 4.5. And then there were no recommended changes by staff, but does your board have any other changes you want to make to any of those before?
One last thing, could you share a little more on the reason it was suggested for 4.4, update internal policies to ensure objectivity and consistency in personnel and business continuity?
As opposed to what the 5.5 is? What the difference
No,
is?
just both of those were included, and it wasn't really something we had put on that list at that point. I was just wondering if that was shared from a lot of departments and maybe what the reason for that might have been. Peeling back a little more of the reason.
Yeah, so 4.4, you heard, especially from your HR director, but we have them in other places. Emergency services, our business continuity plan is over 10, might be 15 years old at this point. Some of our injury and illness prevention program is sorely outdated. So these are places that if we don't have them in place for certain state or federal organizations, it could cause problems for us. Staff have been trying to work on it, but essentially what you're saying, if you adopt this, is that you feel it's equally important that staff prioritize their time to get these things done.
Okay, thank you. It was something that I think is important too, but I thought it was a matter of how many hours are in a day, and that was already ongoing, but not that it was a matter of prioritization. So I'm fine with it.
Okay. And if it's okay with the board, before we go into if we wanted to change anything, I wanted to see if there's any public input on anybody. See that? Okay. All right. Any changes or other amendments to the board goals and objectives?
No, after this, are we done talking about the retreat and moving? We've had a long day. I just want to say it was a great retreat. I really like that guy. I want him back next year so he can look at this list and see how we're doing. But I like that the board, we were already headed in this direction with many areas, but to go deeper, to actually give some more specifics, and then to come back, we'll discuss later about how do we actually measure the success of this is real important to, I think, all of us, and we're going to have that conversation later. But, to save fire, that's one thing, but to save fire and bam, 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 it feels good to know that that's what we're going to be specifically looking at, and hopefully giving staff some better clarification, but also seeing some quantifiable results. So it was a good time. Way too long, but we got to the end of it. So thank you, staff. Thank you, Tracy.
Yeah, I agree with that entirely. It was just having the high level would have been too broad, for my taste at all. And we settled on this, and we had good agreement amongst the board to do so. We wanted things that we could actually have those measurable areas that, we could see that were defined. So thank you. Yes.
Yeah, and I'm really happy to hear that some of the things we came up with, probably from conversations with staff over the last, couple years, were incorporated into this, and things that were already ongoing. I think it's really important we get some things that are tangible wins to be able to show the public. In addition to all the great work being done kind of behind the scenes, here's some real changes that we can quantify and show you. I'm really excited about these things, and I really loved the second day and being able to meet all the staff department heads. I think we got 6 minutes each. But for any of the members of the public watching, there's not a lot of opportunities we have, I think, to just sit without a particular thing that we're working on, and being able to just talk about what are you doing, and maybe there's some cross collaboration. It was a really great opportunity. I hope we do that more than annually. I know that was a logistical round robin nightmare, I'm sure, to organize, especially with COVID. But I really appreciated the opportunity and hearing from staff. So thank you, Tracy, Eric, everybody, Heather. There was just so much that went into it, and I really appreciate it.
I really appreciated being able to attend virtually. I was really sorry not to be able to be with department heads and my colleagues in the room. For those of you who don't know, I had COVID, but a mild case, and so I was able to contribute and be there virtually and not miss a beat. So I was very appreciative of technology and the IT team who made that happen. Thank you.
Yeah, and we missed having you there, but your mind was there, and that was the most important thing. But yeah, I echo the comments of thank you, Tracy and Eric and Cece and all the staff who made that happen. But I want to turn around and really thank the board. Those of you who are new, Naya, who's been on the board for a couple of years. This was something that it kind of, to be honest, it fell by the wayside last year. And it was something we didn't do because there were so many immediate concerns at the time, and something had to give. And so Tracy and I had been talking about this way back in, I don't know, probably March or sometime late in the middle of last year, planning and deciding whether or not we were going to do this. And it took a great deal of, took more work than you might think to organize it and get it put together. But to see the collaboration and the melding of ideas from the board members, I really appreciate it. And it was good to get to know you and to have those discussions in that setting. And I think I think we hit about the right tone. We may not have hit everything exactly right, but this is a process. And in past years, I think there was so many specific demands on staff that we kind of overcompensated the first year I did it, 2019, and it was much too vague. And so what we landed on, I think, is a combination of specific goals, but enough room for staff to kind of work within those goals and find ideas that we might not necessarily have come up with. So I just am really grateful for this board and for staff and all the hard work that went into it. So I hope you know that I really appreciate it. I'm grateful. Any other comments, or I think we asked for public comment?
I'll just make one last comment, and that is just so the public knows, for these 5 things that are up here with the subpoints, I have pages of things. We all have pages of things that we wanted to do, but we're so limited in capacity. So this really was a dance of the board having honest discussion, deciding what was the best for the community and what was attainable, and that's what this list is. So just so the constituents know, when we're talking about trash issues or other issues that we all really want to address, we have to focus our resources. And there's only so much time and energy and money. And so, again, this is where the board came together. This is where we decided. This is where we're going to hold each other accountable and staff accountable for making this stuff happen. So it's, again, good retreat and great things moving forward.
Yeah, and I'm liking where your head's at. I'm thinking trash is going to be on this next year. Okay.
We do need you to approve the board goals and objectives
Okay. In that case, we'll look for a motion.
as amended.
I'll make the motion to approve the 2021 board goals and objectives.
Second.
Okay, I have a motion by Supervisor Goldenberg, second by Supervisor Brandon. All those in favor, please say aye.
Aye.
Aye. Okay, opposed? Okay, abstaining, no. So 5-0.
Thank you.
Great, thank you very much. So we're on item 14, which is somewhat of a continuation of a discussion this morning.
Item number 14, consideration of funding FEMA and eligible COVID-19 related expenses with general fund contingencies. This item requires a 4/5 vote.
Okay, Eric is handing out an updated memo. I'm going to have him tell you why it's updated, and then we'll get into what the staff recommendation is for your board to consider.
All right, good afternoon, members of the board. Eric Earhart. So this is obviously a fluid situation. We've had some updates Sunday as far as potential funding sources, and then even up as recently as last night as well. There was just one section in this memo that deals with the funding that was originally drafted that I wanted to clarify, and just I felt it was important for your board to be aware of. Towards the back of the memo, for paragraph starts, in order to fund these programs, where I speak of contingency fundings. One thing that was pointed out to me that was left out unintentionally was that the prior board had previously dedicated another $250,000 from the general fund contingencies to the fire fund to increase the Amador contract with the Groveland station up there. So those numbers have changed slightly, but again, with the new information we've learned over the weekend and last night, we will not be asking your board to reduce contingencies at this time.
Okay, so the next part is, as we had discussed earlier, we became aware of a grant that Public Health was awarded in December, I think. It's the ELC CARES Act funding, I believe is what the name of it is, $1.7 million. There is a budget that they had to submit for that funding, and most of that is related to staffing for them to do everything that they're required to do, all the epidemiology reporting, contact tracing, a lot of stuff. And Rebecca and Michelle are here. They can give you more. But what Rebecca and I have discussed is, and the recommendation is that the education and compliance can be funded through this grant. However, Rebecca is recommending that we scale back to mostly education. So keeping the education component, it's $2,000 a month. It's not $10,000 a month, which again keeps more of that grant as they're looking at focusing on direct impacts of COVID-19 and requirements surrounding that. And of course, both Michelle and Rebecca are here if you have questions.
So to clarify, the educational piece is $2,000 a month? You just said?
Yes, that was what was on the slide that they had put up earlier for you.
Right.
So what we're looking.
So 10,000 is for everything, including contact tracing, but just the part.
No. Contact tracing is $40,000 a month. That's off the table because again, the health officer is saying they have to continue doing that, and he wants that under his authority to continue. What we're looking at is really just the education and compliance.
Yeah, I missed something here because it says 10,000 for every month your board would like to continue those efforts.
Well, right, that's why I said we're not going off of this. We don't need contingencies anymore, so it wouldn't matter. But it would be 10,000 if they did the education and compliance as it is put together today.
Okay.
Yeah, they're just recommending, Public Health is recommending not to do it at that level. They're recommending the $2,000 a month. Yeah.
So I'm just phrasing it so that I can understand myself. So status quo as of today, 10,000 a month, most of which would have to come from contingencies?
No, it could still be funded
It'd
through
still
this
be
other
funded,
grant.
okay. So none from contingencies?
Nothing from contingencies.
All right.
Right.
Okay, and so what we need to decide is which level of
Program do you want?
program do we want, understanding that it's not going to come out of contingencies or the general fund in general.
Right, and it could cut into their grant funds available to do that direct response too, if we were to do an extra 7,000 per month.
Okay.
Okay, so grant will cover their $40,000 a month for contact tracing, and they're recommending the $2,000 a month for the educational component.
Which will be covered by the grant as well.
So they're recommending option one. Okay. And so then those two part part-time disaster workers, right? And then one supervisor, we're not laying them off, they'll be reassigned, is that?
Right, so the individuals who have been furloughed as a result of, say, recreation, it's really only recreation, it's not library anymore. We would first move them into the other program, as we would be required to do through, and then we would work with the other relief, non-benefited staff after that. So we would move them into that program to keep them working.
Okay, so no, we're not losing
You may,
people
there
from-
would be some part-time people who could. And again, really, I'm not running the program,
Yeah,
so
how
I don't
many-
know if they need
How
3
many
or 4
are in
people.
how many people working in option one? Part-time, is it one person splitting duties?
It's up on the screen there, but yeah, here's.
So Supervisor Kirk, for option one, we would use existing staff, and we do have disaster workers that are currently working in education and compliance. For option 2 and 3, of course, we're not wanting to go into option 2 or 3. So the folks that are right now dedicated to option 3, we would move them over to do contact tracing, contact investigation, so they would still be working, but not in education and compliance.
Okay, so they would help with contact tracing,
Yes.
which is Dr. Sergenko's
Yes.
priority. So, okay, so if that's his thought, then I think we're running out of effectiveness with education, but for $2,000 a month covered by a grant, why not?
Yes.
Why not keep? Will that also continue to let businesses know if they need coverage for any PPP? Or is that thing's over, huh?
Yeah,
Okay.
that's-
Well, we
that's
got to
not
have
this.
info to give to the state if they request it. So at least we're doing the bare minimum on that.
I just had a quick, I just want to clarify my understanding on this, because I think we have a financial responsibility to try and save money. I just want to make sure I understand it in a way that's not going to jeopardize public health. So we are still doing all the things that actually, I think, identify cases, testing, vaccinations. It's not cutting anything that actually potentially would mean somebody might get COVID and not know it.
You're correct. That's why we are asking for option 1, because option 3 would then cut into the core response to COVID, which would be contact tracing, contact investigation, and we don't want to go in that route.
Okay, so actually, a maximal approach in this takes resources from what
Yes.
are probably actually addressing the crisis.
Absolutely.
And like Anaya said, to folks who probably already have heard a lot of it and getting the letters in there.
Yep.
Okay, I just wanted to clarify that. And one last question mentioned from Tracy, the supervisor part-time worker, you said potentially were furloughed employees from recreation. So would they be moved over to a different department or to recreation and then still be paid? So my question, I guess, is, are these real savings, or is it savings from this line item at the expense of another line item?
It's real savings, because right now it's real savings, because it's moving from what we were anticipating being a FEMA-funded program, contingency, moving into everything into ELC, which is the funding that we have there. So that supervisor will then be reabsorbed into public health to do another function. And there's many functions that we need a supervisor level to help us with.
Well, I'm happy we're putting the money towards actually fighting this and not just having to send the letters and stuff, as minimal as possible. So thank you, and for having a recommendation that I think is not supporting the unfunded mandates, but is supporting addressing the crisis.
So I hear both sides of this, and I agree. I was really more inclined to go with option 2. My reasoning is that we're not seeing, obviously, a lot of cooperation from certain members of the community, and so I know that the education doesn't do everything that we would like it to. With just getting out of the stay-at-home order, we don't know what the impact is going to be if we're going to see some increases there. But really, right now, we talk short-term and long-term goals. Well, short-term goal would be to get to red, and I would just like to see us have a little more emphasis than going to the minimal. It's really all about the cooperation, right? And it's the business part of it is the smaller part of it. Is the gatherings. is really hurting us here. If we could get people to cooperate and mask up and keep the distances and not have these gatherings, you know, it would, that combined with the, like we talked about earlier this morning, you know, the vaccines, you know, would do a lot. So anyways, I'm just throwing that out there as a thought in the middle. I think sounds like we've got enough funding that it wouldn't be an issue, that it's not going to get into interfering with the contact tracing from what I'm hearing, or maybe, but if I'm wrong, please tell me.
So 5,800 versus 2,000, that's $3,000 a month difference. Right. And what that does is that reduces the amount of time that we would have our disaster workers be dedicated to this, to the response. So as an example, we have in our budget 8 months for a disaster worker. So if we then include option 2, that 8 months now goes to 3 months or 4 months. So it does reduce the amount of staff that we have dedicated to really the core work of COVID. And that's our contact tracing, that's our contact investigation.
So I understand that if you look at that in the pure sense, but if we've got $1.7 million in additional funding, I think this is new funding that we didn't have until this, over the weekend or whenever it surfaced.
But the 1.7 million is lasting us 2 years, and we don't know how long this response is gonna carry on. So we have to be prepared for this response to last longer than, 2021. And we just have to be, just cognizant of making sure that we don't spend all our money in the first year when we might still have a response that we need to deal with in 2022. Okay. We just really want to be conservative.
Okay, so
I'm going to look to see if there's any public comment. Okay. Okay, no public. Sorry, Supervisor Half.
Thank you. So, Rebecca, I know the prior board at the end of the year made the decision to use contingency money for both the contact tracing and the education piece, so there wouldn't be a gap. What I want to know is if this ELC funding is now going to go back to January to cover, so we're not going to spend any of that already. Okay, good. All right, thank you.
Supervisor Campbell, just real quick, because I want to make sure I understood Supervisor Goldenberg and make sure there's no miscommunication. It sounds like you were maybe wanting education and compliance to be more focused, not necessarily on the businesses, but on individuals. I'm not sure if that's, but the only reason I bring that up is that's never been something they were tasked with, and that would be something your board would need to discuss further, that if that's where you wanted to go, that's not what that program did, and so there would just need to be further discussion on that. That's all, if I understood you correctly.
Yeah, I wasn't pointing to that directly, Tracy, but I mean, it's a known fact that, that's where we're having a lot of issues. So some of those actually do equate to businesses, right? If somebody's doing a wedding or has something like that, they have a gathering in the process, but going after just simple gatherings that's a pretty nebulous thing to try and, very, very difficult to even think about trying to go there. So no, I appreciate your,
Okay, are we ready to vote? Okay.
So I would make a motion, item 14, we're on 14, right?
Yep.
Yes, the amended version. Consideration of FEMA COVID-19 related expenses, and as staff suggestion, I would recommend that we go with option 1 moving forward.
Second.
Okay, a motion by Supervisor Kirk, second from Supervisor Half. Call for the vote. All those in favor, please say aye.
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 Opposed? Abstain? Okay, 5-0. Motion passes. All right, item 15. It's our second to the last duty of the night, I think. Will you please read item 15, Ms. Wright?
Item 15, update on winter storm activities and consideration of providing direction on further actions to address impacts of the storm. including continuation of Public Contract Code Section 22050, delegating authority to the County Administrative Officer to authorize to order any necessary action to repair or replace a public facility, take any directly related and immediate action required by said emergency, and procure the necessary equipment, services, and supplies for those purposes without giving notice for bids to let contracts.
All right, thanks very much. Good afternoon.
Oh, it's green. I can see it. Good afternoon, Board of Supervisors. Dory Beats, Office of Emergency Services Coordinator, with an update. As a result of impacts from the recent storm that started last week, your board called an emergency meeting on January 29th to proclaim a local state of emergency in our county. In doing so, you delegated by resolution the authority to order any necessary action to take any directly related and immediate action required by the emergency, and to procure the necessary equipment, services, and supplies for those purposes without giving notice for bids. Over the weekend, county staff and partners worked hard to coordinate response and repair of much-needed power infrastructure. As you can see by the photos, and we'll just go through this, there was quite a bit of snow and a lot of downed power lines. The incredible coordination that has gone on between our offices, Public Works, County Roads, PG&E, and many others has been instrumental in our efforts to protect life and property. I want to especially thank Kim McFarland and Mike Cognetti and all of the roads crew, the amount of snow plowing that has been done, that it continues to this day. Our PG&E partners, Michael Gaffney, Chris Harden, Pamela Perdue, Bobby Severson, the amount of work and dedication they have in coordinating to make sure we are restoring the power to the residents in our community. Tuolumne County Sheriff for assisting us in service calls needed. Red Cross, I have just received confirmation there were 6 homes completely destroyed, uninhabitable in the Sugar Pine Mobile Home RV Park. Red Cross helped over the weekend to place those families and get them assistance. Also to CAL FIRE Vallecito Hand Crews, where you can see actually here, which have teamed up with our roads and tree contractors to remove some of those downed trees in the roadways. CHP also was assisting us, obviously, in staying connected and coordinating and staffing. And then also our partners, faith-based community, Word of Life Fellowship, that opened up their doors to many of those families that needed assistance. The National Weather Service has issued a winter storm warning that started last night and will continue until tomorrow. The snow elevation may be a little bit higher, but they're estimating 45 to 5,000 feet with additional snow. We also possibly or will be dealing with potential rains and melting of snow and flooding. Our team will continue coordination calls twice a day with all of those entities and work to address any of the issues. We asked the board to continue the resolution passed last Friday with one change that I presented to you, a whereas that states, due to the severity of the storms and the continued conditions of extreme peril to the safety of persons and property, staff continues to work with local contractors, utility companies, and public works to mitigate and reduce the risk to life and property. With the additional winter storm warning at elevations above 5,000 feet, requiring immediate action to prevent or mitigate the loss of impairment of life, health, property, or essential public services. Happy to answer any questions. And I want to thank Supervisor Kirk for pushing out a lot of our photos for us. Thank you.
Supervisor House?
Yeah, I just wanted to ask something. We had high winds on, I believe it was the 18th, Monday into Tuesday, that did quite a bit of damage, and I'm just wondering if we could backtrack or if it's too late to go back to the date of the 18th to cover any other damage, because we had some damage up in the high country with trees coming down and everything during that event as well, and make it a cluster event rather than starting on January 26th. Just a question.
Tracy?
I think what the best way to look at that is let us look at the emergency code and see what it allows you to do. Since your board did proclaim on that day, We know that there's greater flexibility for proclaiming after an event. I've never gone and done it before. We actually had to actually start acting. So let's look into it and we'll see what we can do.
And I do apologize to add this other correction in the resolution, in that first now therefore be it resolved. At the very end, the imminent threat of disaster as a result of the storms, not of tree mortality. Thank you, Sarah and Eric.
Were you borrowing language?
Hey, when Tracy says get a resolution ready in 10 minutes, well, I'm going with the flow. So.
Well, you picked a good one
Yes.
to borrow from.
Thank you.
Was any other comments,
Yeah.
Supervisor?
First of all, Dory, thank you, and Mike Cognetti, Kim, all of our partners. I can't name them all because I've grown up in Miwok and I've seen big snows. People complain about snow berms. Well, I had one lady from the city chew me out, and I found out she moved up from the Bay Area 3 months ago. I said, well, grab a shovel, welcome to Miwok. But what I have not seen is this amount of damage from trees, taking out power lines. I think with the drought and with the stressed trees and the windstorms, it was just a perfect storm for this carnage. And so just thank everybody. Been doing several updates. One of my main concerns, though, moving forward is I'm glad you guys stopped on this picture, because if you look at those trees in the far distance leaning over, and there's several other pictures, is some of the tree fallers, some people that I'm talking to, it'd be nice to get some outside expert opinions, but one of my main concerns is moving forward, there's concern that a lot of these trees are now compromised and they're going to come down eventually again, whether it's another windstorm or another snowstorm. And so we have this immediate problem which we're addressing, but I don't know if there's resources or funds, or maybe we can look to what other counties are doing maybe, but you look at these pictures of those trees, scroll to one. That one right there on the far right is leaning over a house. And the only reason why it didn't fall is because some people got in there with ropes. They climbed up there and they tied it to another big sugar pine 100 feet over here. So it's hanging over a house right now, and it's going to come down. But obviously we don't have the resources to go take that tree down because we're dealing with the road. So there's this other problem brewing. So I don't know when that discussion is going to happen, but I think it's going to have to happen soon, because if it falls, there's trees that are going to take out power lines. Is that going to be a PG&E issue, or is it going to be a county road issue, because they're going to fall on county roads as well? But I just feel like there's further discussion needed. But for now, thank you guys for the work, Dory. I know I have this saying where I don't like to micromanage people or anything, but when it's in your district and when you're getting calls all night and all these things happen, I have to be involved. I have to know what's going on. I have to give answers. And so I just thank you guys for all working together and for understanding. But so I'll leave it at that. Thank you.
Yeah, absolutely. And I think that's the importance of continuing this, because we haven't even begun to really truly assess the damage that has occurred. So.
Supervisor Brandon?
Hi.
There we go. Hi, Dory.
Hi.
I just wanted to echo, thank you. Seeing those photos is crazy. And anybody not able to see these, hopefully they can watching. It's just trees bent over with what must be hundreds of pounds of snow toppling over. It's very scary to imagine being up in that environment right now, potentially any time without power and without a plowed road being able to leave. So, saving a lot of people up there. I've just seen a lot of, I think, discussion on this that I had some questions about. So we had an emergency meeting with the board, limited notice, but it was an important issue, and everything was done as needed for the topic to allocate money to be able to deal with some of these kind of cost overruns or overtime or whatever is needed at the discretion of you in the CAO's office. I did have questions about, because we had brought up in that meeting, where the action went for having the lit up signs. I did see one email on some potential language. Could you tell a little bit more about how many were potentially done and kind of where?
On signs?
Yeah, the Caltrans kind of signs to warn. A lot of the things was, I think, after we had our meeting, seeing the photos of, don't want to say flatland around here, but tourists, right?
Yes, yes.
Coming up, barbecuing on the side of the roads, sledding, and stuff like that. And I think people were wondering, and we kind of talked about it, and I think sent direction to ask if we could close those roads, and what the follow-up on that over the next few days was.
Yeah, obviously lots of conversation. We don't have the authority in the county to close the state highway, only CHP does. The CIO and had conversations and talked about the board's concerns with respect to that, and it was decided no, not to close the roads. They did, however, though, move some chain control and assign officers to those chain controls, and I think that hopefully helped. I personally did see a lot of filtering off of the main highway into other communities, particularly Twain Hard, and I know Miwok, where folks couldn't get any farther because they didn't have chains. So they were set up, picnicking in parking lots throughout Twain Hart. So obviously the sheer number of tourists and visitors that we had over those 2 days, definitely Saturday, impacted our efforts. And so there was a lot of coordination, a lot of frustration from our crews because access, just getting up the highway to get to the different subdivisions sometimes took hours. Because of the sheer number of folks out on the road. And so, thankfully things worked. And definitely is it something that we can look towards the future, how we can coordinate that a little bit more. But we just really didn't know the number of folks that would be coming up to enjoy the snow.
Only speaking for myself, I think it was well documented with a lot of photos and everything. I would be very interested in that conversation for the future. Obviously, it was a huge storm, but we didn't need the complications of all the people jamming up roads to make snowmen.
Yes.
Which, is it's kind of a silly thing for anybody to put, other folks' lives at risk for it. And so anyway, I appreciate you explaining that. And so that was, I guess it seemed like a state decision to not end up closing the road there. I also wanted to ask, one thing that was brought up in that discussion was related to the snow plowing and how vehicles were, I think, two categories. One were tourist vehicles kind of on the side of roads, and the other were residents who had parked in streets where they're not supposed to, kind of preventing normal plowing services. Were tickets given out, do you know? And a lot of tickets maybe, and is there anything that we can change to hopefully change that behavior for both groups?
Well, there were tickets given out. I don't know the number, but I can find that for you. We did enlist, obviously, both CHP and sheriff to assist in that. The county did decide to close some roads, and we notified the media and our partners of road closures to allow us to do better plowing and repair work for PG&E. So I think more education, we did send reminders. We did social media. Public Works did it as well as we did to make sure that our residents, were being reminded that even if they're going to, dig out their driveways to make sure their cars weren't, impeding the plows that would be coming through. So I think we just continue with that kind of education and get folks to be a part of the solution as opposed to being part of the problem.
Okay, well, I hope it was a lot of tickets that might make people think twice about doing that in the future. Thank you, Doreen.
I'll find out for you.
I know it might not appear that way to many people, that there really was a lot of organization out there. We would call it organized chaos many times, and I've been a part of many emergency incidents, and there's a lot of different entities that came together on this. And I know I've got a friend that lives in Sierra Village, and he got 6 feet of snow. Another friend in Long Barn, they got 6 feet. The guy in Sierra Village personally saw the equipment come in on their roads, and they had 2 medical emergencies. One was a heart attack patient on Friday, and I forget what the other one was on Saturday. So they had snowmobile teams coming in. I don't know if that was the sheriff's group or maybe Station 55 with their stuff from up in Pinecrest. But anyways, they did just a really good job all the way around. And it's so difficult. I can remember a time myself responding as a battalion chief to a snow incident, and my vehicle was the only one that got to the structure fire. It was gone by the time I got there. But yeah, because you just can't get fire equipment in. even if they're chaining up and stuff, you get these types of situations. So good job for everybody. Thanks.
Yeah, there were multiple instances where we definitely worked as a team, whether it was PG&E, contractors, roads crew, sheriff, and ambulance, fire, to get folks out. And so, very proud of that coordination in the group that worked hard to get that done, because in one particular instance that Supervisor Kirk's aware of, somebody could have lost their life if individuals did not act on that. So we're very fortunate.
Yeah, and, I don't know, I was brainstorming what to do about the snow play people, and I don't know, maybe we should look at opening some kind of snow play park or whatever kind of resources are available just to get people off parking on the state highway. I'm just kind of brainstorming, throwing that out there. If there are any properties up the hill that we could look at doing something like that and maybe charge them a little bit to park there and then get them out of the freaking town, that would be nice in cases like this. But yeah, I agree with Supervisor Goldenberg and Supervisor Kirk. There was, it looked like a mess, but there was a lot that went into it, and had the work of, PG&E, CAL FIRE, roads crews, sheriff, all of these individuals getting up there. If they hadn't been up there doing the work, getting the roads cleared, you wouldn't have been able to get past Twain Harte. And so it's really look bad, but it could have been a whole lot worse. And I know in my area we get a fair amount of snow in certain parts of my district, and Cedar Ridge and Middle Camp and Big Hill come to mind. And we actually did have a couple search and rescue incidents that took place up there, and they were able to get the snowcat up the hill, off the trailer, get the people, get them out of harm's way. I don't know how they do it so fast, but it's just amazing. Shows the experience and the skills and logistics that we have. And so really big shout out to search and rescue for the work that they do. And if you look at some of the historical pictures for our county, it used to be the norm that we would get snow like this, and that hasn't been the case for a decade or more since we went into that really long drought that we're only now kind of creeping out of ever so slowly. So when you lose that generational knowledge of what to do when you get buckets of snow all in a short period of time, you get challenges like this.
Yeah.
And the other thing that I'll say is that I was interviewed by KVML. I think it was the day before or early that morning, before we really knew how bad things were. Right. And I drastically understated the scope of the problem. Because we didn't know it was quite the problem hadn't started yet.
And to that point, real quick, just go to that last photo of today. Keep
last
going.
one.
Keep
Very
going.
last one.
So these were coming in during the board meeting. Keep going.
That one.
Right here. So even though it stopped snowing, there's just trees all over the place. So we're still figuring out, like Dory said, how bad the carnage is. So I think that's why it's important that we keep hitting it, get it cleaned up as fast as we can, and get ready for the next one. But
Yeah, and I would like to just add, I left off another partner that was huge for those families that were displaced and needing a place, but that was animal control. I made a phone call to Michael, and he was able to get officers up right away to assist those families and their animals. Because oftentimes when you're placed in a hotel through Red Cross, they don't allow you to take your animal with you. And so hats off to those guys and those folks that really assisted us and will always continue to assist us when we need them.
Any public comment? All right, are you looking for any direction from us, or is this purely update?
Yes, Tracy.
Yes, I'm sorry, we need you to approve the new resolution with the edits as outlined by Dory earlier.
All right, do I have a motion to approve the new resolution?
yeah, I'll move on staff, or on them. What am I moving on? Proclaiming local state of emergency. The revised resolution for the local state of emergency due to the winter storms. Thank you.
Okay, motion by Supervisor Kirk. Do I have a second?
I'll second.
Second by Supervisor Goldenberg. Call for the vote. All those in favor, please say aye.
Aye.
Aye. Opposed? Abstain? Okay. Motion passes 5-0. Okay, I think that's our last regular agenda item, so we'll move on to report correct? Am I correct now? I'm not missing something? Okay. I always get confused when the item is split from one page to the other. I'm never quite sure. So I guess I'll start with County Council. Okay. CAO. Okay. Start with District 1.
Just getting the feet on the ground still. It's been a heck of a time between all the meetings we had in January. It was rather busy. Then, what came out of the workshop and the storm activity and things that kind of revolved around that. But, yeah, just glad to be here and glad to be working together as a team. Thanks.
Great. I guess I'll keep going. Supervisor Brandon.
So this past week, or past couple of weeks, there have been a few commission and committee meetings that I think the first ones have been canceled of as we kind of transition. There were a couple that had the opportunity to first be able to attend. First one was Central Sierra Child Support Council, JPA with Anaya, their first organization or first group of that, which is a regional group working on child support issues. As well as obviously the board workshop, which we talked about earlier. And I think a lot of good stuff coming away from that. In addition, we also had a meeting of the Tuolumne County Planning Committee, which is different than the Planning Commission, discussing a few things of the strategic kind of projects on there, as well as meetings with several different staff members and constantly sending a bunch of emails asking questions all the time and blowing up inboxes, but especially with Quincy, Justin, and Cole to, I think, continue improving my own understanding of how the county operates and where we can be able to make a difference. I also had a couple of face-to-face visits in my district on particular constituent issues, and I want to continue to encourage the public. If you have any ideas, if you have any concerns, please reach out to me. I can't guarantee that I'm just going to snap and fix it, but I can at least try to get you an answer, do the best I can to help understand it and see what opportunities there are to move forward. I'm here to be your advocate, and please always feel free to reach out. I answer a lot of messages, and that's the favorite part of this job for me. We also had a online town hall. It's the first one of a series I plan to do every other Tuesday, alternating with the board. I'm just calling it Talk Tuesdays. Earlier in the day, it's also going to be my office hours. So between, I believe, the hours of 1 and 4, if anybody would like to schedule a 15-minute meeting with me, just to quickly give me a synopsis of what you're facing or ask a question, email into the board. Otherwise, I'll be doing a topical or sometimes overall town hall, might bring in some staff. This is just to keep getting people into the process. I'm huge on trying to bring more public input and communication. So check that out for my Facebook page where I will be advertising it. There's also a huge discussion in Jamestown. I did not organize that, but it was something that I attended. Oh, it was something that I attended there, and it was really actually very inspiring to see so many people out there talking about homelessness in Jamestown, caring about it, asking questions, suggesting ideas, potentially almost 100 people. And I think that, to me, is exactly what democracy looks like. And I think we should be encouraging participation at every level. So to the folks that came out, that's great. And I look forward to, if you reach out, being able to have a conversation on it. I think that is pretty much it.
All right, great. Thanks very much. Start at the end there. Supervisor Huff.
Yeah, I've got several items. I've had lots of contact with constituents from District 4 and sometimes not District 4. I won't go into those, but I've been able to help in some cases, help smooth things out, and others, they're more civil matters. I've been attending different committees and commissions, but the one that I want to report on right now is the RCRC meeting. That's a big one. It lasts pretty much all day. In the big meeting we had last month, there was a rundown of the proposed state budget. So I just want to give the highlights of that, and I've got a way for you guys to access that if you don't already get that rundown. But it's a record-breaking $227.2 billion for the state of California, this new proposed budget that will start fiscal year 21-22 in July. with a surplus due to less spending due to the pandemic, of all things. So I thought that was interesting. Highlights from this proposed budget, $1 billion for the implementation of a comprehensive forest health and wildfire prevention strategy, which feeds right into one of our big priorities. An additional $550 million for small business COVID-19 relief grants. Now, of course, this won't be for a while if it in fact passes. Offering grants up to $25,000 to micro and small businesses impacted by the pandemic. $14 billion for an equitable and broad-based recovery package for businesses and individuals. This is in addition to the last one I just mentioned. $600 stimulus for people, individuals that are low-income California residents. $300 million for vaccine distribution. We could sure use that now, right? And the state's working on finalizing the allocation of the remaining $800 million in funds to pay for additional emergency response costs for public health expenses and public safety payroll costs. So those are all, there's a lot more in it. What's not in it, I found interesting, is there's no appropriation right now for the approved Broadband for All initiative that was just passed. No money for it. So I think that's interesting, and maybe we can affect some change there. So what you need, if you want to learn more, I just gave you the very top highlights, is you would access RCRC, the Rural Rundown, dated January 8th. And you can get the full report. I'm going to be having office hours in Groveland, but it has to be at a time when I can actually meet with clients, or not clients, but constituents. And so I don't exactly know when that's going to be, but the place will be at the Little House off of Merrill there in Groveland. And of course, I'll have office hours here as well. But it looks like it will be on Mondays when they start. And when we get closer to that time when I can meet with the public in person, I will give that information out again. I will be having a town hall coming up on the 18th, Thursday evening from 6 to 7 p.m. We will be doing in Office of Emergency Services jargon, it's called a hot wash for the evacuees. And what it will be is a review of what went well in the evacuation and what were the challenges, so that we can develop an after-action report and we can make improvements for the next time we have to evacuate. Very important document to have that we can use for future emergencies. So I look forward to joining with anybody from the public who was evacuated during the mock fire. That's what this will all be about. And lastly, one of my contacts at RCRC is Stacy Heaton, and she has provided me with information. There's an article here, and it's the subject is California can learn from Colorado on protecting homes from wildfire risks. And in it, just a couple of sentences, it says, California's approach of creating price restrictions on insurance premiums has forced hundreds of thousands onto last resort bare-bones state plan. Meanwhile, Colorado's innovative approach incentivizes homeowner mitigation and allows premiums to fluctuate depending on keeping homeowners insured. California should look to Colorado as a model. And she has suggested that I contact her for more information. Chairman Campbell, I have sent you that information. She said I could invite anybody that I wanted onto that call. I'd like to make those arrangements in the very near future so we can learn from Colorado. There's, I guess, just several counties in Colorado that have made vast improvements, and I would like to do the same thing here.
All right. Thanks a lot, Supervisor Kirk.
I would say to that we get a hold of Ricardo Lara's office. I've dealt with him a few times. And that's the difference between, how do you say it? People will do right if you give them a chance to do right. That's how this country runs. I went to way too many meetings. Jaren touched on them, so thank you, Jaren. I like going to meetings with you because then you'll take care of it during this time. But then obviously the emergency declaration. I've been up the hill. I mean, I don't have weekends. Usually I have like part of a day on Saturday and part of a day on Sunday, but just Friday, Saturday, Sunday's just been sucked up the hill. I spent a lot of time up there shoveling people out, family, taking pictures, driving around. So that's just sucked up the whole weekend, and until this thing's resolved, I'll be done with that. But the planning committee, we had a discussion about what the priorities will be for that department moving forward, so that'll come to the board shortly. But that was an important meeting, and I'm going to keep it short. And I was board meeting out in January, so I'm looking forward to getting past all these board meetings. But they're important, but yeah, looking forward to the future. So thank you.
All right, thank you, Supervisor Kirk. I had the exact right number of meetings over the past period of time. Not too many, not too few. Now, obviously, I guess I'll start from the back and go backward. So Sunday, there was a flurry of activity that I was involved in related to the third-party administrator. Ideas coming out of the state, obviously something that I didn't support, and I don't think it's good for our county, and we discussed it a little bit this morning with the board, so I'll be sure to express our frustration and use as many tools as we can to try and amend that decision or have it changed outright to get as much local control over our vaccination plan as possible. I think we've been doing a good job, and I would like to continue with things the way they are, except with the major change being that we'll get access to more vaccine, which is the main problem we have right now. Coming up on February 10th, there'll be a COVID information night. They're arranging. I don't believe we have a time scheduled for that yet, but that will be forthcoming. Do we? Okay, so that will be forthcoming. I also happy to say that on Friday we continued our weekly press conferences with the help of Dory Beats and Rebecca Espino from Public Health, communicating with our partners in the media, and so that's going to become a regular weekly feature of the county. We're going to be communicating with our media partners. Obviously, on Friday and Thursday, I spent a lot of time driving up to Cedar Ridge on both Thursday, Friday, and Saturday, talking with and trying to get as much help for residents stuck in the snow up there. Also, we had more snow than you would expect in Upper Crystal Falls as well, creating some problems there. We had the Finance Committee, which I had with Supervisor Goldenberg. We discussed and made a recommendation to the board, which we will get shortly in the days to come, about increases to ambulance rates and mandated fire inspection, and approving a mandated fire inspection schedule. So we'll be discussing that with the full board here in one of the upcoming meetings. Also participating in our YOGAC and local COVID briefings, and then participating in CSAC wildfire and COVID-19 conference calls with our state and federal partners. Extremely useful to participate in those. We usually hear about things a couple of days in advance, so it gives us a little bit of an advantage there participating in those. So I always make sure to listen very carefully. And then the last thing I'll mention, this is something that I had wanted to bring up last week, but was unable. So the residents of Willow Springs have been reaching out to me for really since before I was elected. They want their road fixed. Willow Springs Drive, it's the main collector for that neighborhood. It's in terrible condition. It's a relatively flat, long road that feeds most of the intercommunity roads, and the residents of that town, of that neighborhood, have gotten together and they organized a petition. I've received 242 petition signatures which I delivered to the Department of Public Works on behalf of the residents of that community, asking to have improvements made to that road and be involved in any board discussions that might be coming in the future about road improvements, and they'd like to be on the list. And I strongly agree with their assessment of their road, having driven it many times. Our babysitter lives out there, so it's always feels a little bit like you're driving off road when you go down their main drag there. So I'm really grateful for them for reaching out to me, and I hope I can that we can work to get some road priorities out there, and that's one of the things that's considered. And that is the end of my report. I actually forgot to do County Clerk. Any reports from Ms. Ryan?
Just the board clerk would like to thank the IT team and all of their help for making these meetings a success. It's really great to have their support.
So the unsung heroes of our board meetings is IT, and then Tracy, who sits in the back and making sure that everything works, and when the problems do arise, they're able to fix it very quickly. So thanks very much to them, and I agree completely. All right, with that, we'll end the board meeting. Thanks very much. Meeting's adjourned.